initiatives.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है.
Exceptional contribution to health space has also been recognized through such initiatives. These forums also received an overwhelming response from the industry. Several legendary brands have come out to support these efforts and have become the real change agents. In its efforts to make health a priority, IHW Council is committed to the making of a healthier India. Global health hazard, economy and social uncertainties due to COVID-19 pandemic made us more firm and responsible in our ideology, and we immediately felt the need of taking our efforts to the masses through web and launched the landmark initiatives through our social media handles. Over the past 4 months, we have hosted many virtual summits, talk shows and symposiums, mega movements, and reached out to millions of audiences online through our extensive promotion on social media and digital space. IHW Council, always welcoming the like-minded companies, social organizations and individuals engaged meaningfully in uplifting people, communities and societies. Let's join the movement for people to get their basic birthright: clean air, clean water, good food and good health, and help in making Bharat a healthy nation.
Thank you so much. So good morning, everyone. I am Kamal Narayan, CEO of Health and Integrated Health and Wellbeing Council, a not-for-profit social impact initiative to promote health for all. I welcome you all to the 4th CSR Impact Summit and Awards 2020, the COVID Special Edition, in partnership with Jagran Pahal, that recognizes CSR projects that made a difference in the lives of people during this raging global pandemic and also beyond it. This is also a platform for in-depth discussion on changing attitudes of businesses towards their social and environmental responsibilities and the difference they can make to the lives of people and to our nation. The extraordinary times of COVID-19 has fundamentally changed the way public health has been looked at and dealt with by most of societies globally. It has made rich and poor, weak and strong, developed and developing all come together and fight this common threat of our health and to our lives. This has literally made health as everyone's business. The message we at ISW Council has always been emphasizing on, while exhorting people, governments, and businesses to invest their efforts, resources, and money to ensure good air, good food, good water, good lifestyle that also includes good sanitation and good healthcare to achieve the dividends of good health. The COVID-19 has also made our businesses and industries understand that investing in health of the people they do business with is of paramount importance for their sustainability and growth. And this is making CSR no more remain just a charitable work by business. Those years back, India became the first country in the world that took a radical and far-reaching step of making CSR mandatory for business and profitability. That expanded the horizon of CSR sectors and activities. The present crisis should make everyone understand their social responsibility more than ever before. And we are seeing that this consciousness is inspiring at all levels. The colossal social support that we received of CSR Health Impact Awards, we feel duly rewarded to see that health is indeed becoming everyone's business. We are honored and privileged to have some of the greatest champions of health, humanity, and social service in this inaugural session of 2-day-long summit. Their thoughts and actions have helped build movements of social responsibilities towards health and environmental causes and made world more livable for millions. Let me welcome our very esteemed guest of the day, Dr. Bhaskar Chatterjee, a man who is widely respected as the father of CSR in India. Dr. Chatterjee is a former Director General and CEO of Indian Institute of Corporate Affairs. A former bureaucrat, he was part of the team responsible for shaping India's response to the global economic crisis of 2009. He is also a prolific author and a well-known public speaker. Thank you so much, Dr. Chatterjee, for joining us today. We also have Mr. Atul Bagai, Head of Country Office of United Nations Environment Program, UNEP, in India, and is a veteran sustainability professional. Prior to the UN, Mr. Bagai has worked with the central and state governments in India. Thank you so much, Mr. Bagai, for joining us today. We are also honored to have with us Sadhvi Bhagwati Saraswati ji from Parmarth Niketan Ashram, a spiritual institution based in Rishikesh at the foothills of Himalaya in India. Sadhvi ji has been closely working with Swami Chidanand Saraswati ji, a lifelong crusader of health, sanitation, and environmental causes, and who has also founded Ganga Action Parivar and Global Interfaith Wars Alliance. We are happy that CSR Health Impact Awards 4th edition is also being supported ideologically by Global Interfaith Wars Alliance. Sadhvi Bhagwati is the Secretary General of Global Interfaith Wars Alliance and President of Divine Shakti Foundation, another landmark initiative from Parmarth Niketan to promote women empowerment and well-being. So I welcome Sadhvi Bhagwati Saraswati on this very important discussion. We are delighted to have Mr. Jack Sim, a personality famous across the world, and for something which he pursued with all his passion, and the cause of getting a toilet for every family and for every human being in this world. The founder of the World Toilet Organization, a groundbreaking initiative that won many awards and accolades around the world. Jack is a source of inspiration for millions who wish to make a difference in their life. In 2006, Jack was invited to launch the German Toilet Organization, and he is also a founding member of American Restroom Association. He has been named as the hero of the environment by the Time magazine in 2008, and Jack is also part of the World Economic Forum's global agenda for water security and for social entrepreneurship. Thank you so much, Mr. Sim, for joining us. We are really delighted. Uh, I'm sure it would be almost a noon or afternoon in Singapore. So thank you so much for sparing your time. Dr. Hema Divakar is another very important guest in our this discussion today. She is the founder and medical director at Divakar's Specialty Hospital in Bangalore, which is also the first private hospital in Karnataka to obtain ISO certification. Dr. Divakar is a women's health champion and has a keen interest in high-risk pregnancy care. She has been consistently working with Government of India, state governments, and many other organizations, including ISW Council, to spread more awareness and help more women to get health care where they need at when they need. Thank you so much, Dr. Divakar, for joining us. We also have Dr. Rajiv Gautam, the president of Horiba India. The company under Gautam's presidency has taken a leading role in establishing partnership between the industry and academia, and is consistently working towards making greater social impact through its innovation and business. Thank you so much, everyone, on this very special show. So before I go forward, I would also request our online viewers today to keep sharing and liking these discussions, and share on your wall, so that these inspiring words from these very special people can reach out to as many people as possible. So let me begin with Dr. Bhaskar Chatterjee. Dr. Chatterjee, you are the one who actually made India become one of the world's first country to recognize CSR as something very strategic contributor to transform a country's fate. And how people from private sector can actually contribute to the building of a nation. So I would like to hear your kind message and your experience, and how do you see that CSR is going to help our country do better when it comes to health, especially after this extraordinary crisis of COVID-19. Mr. Chatterjee.
Thank you, Mr. Narayan. It is such a privilege and a pleasure to share this platform not only with you, but our very distinguished panel whom you have brought together. Indeed, the journey of CSR has been a very epic one over these last 6 years. As you rightly said, India was the very first country to have mandated CSR for the profit-making companies of this country. And over these 6 years, we have seen a lot of innovation, a lot of traction in the area of CSR. The idea of bringing in that legislation was to give the private sector and, of course, the public sector a role in the development, in building the development momentum of this country, contributing to the nation's development. And initially, of course, corporates were reluctant at having something like this thrust on them. But now I see that they have converted challenge into opportunity. It is they who are driving the entire CSR ecosystem in the country, and their contribution has been indeed seminal. Specifically with respect to the health area, if you look at the CSR pie, in this country, it is almost about 16 to 17,000 crores annually. And out of this, about a little over 50% is taken up by education. But a very close second is what we now call WASH, in which you have water and sanitation and health all put together. Ever since our Honorable Prime Minister brought the Swachh Bharat initiative into our consciousness very strongly, there has been a tremendous push towards sanitation and health issues taken together. And I'm very happy that the Council has promoted this so actively, so ably, and in the course of rewarding some of the great achievers through your CSR Health Awards, you are providing a great deal of energy and encouragement to those of our people who are striving so hard at the grassroots to build health and well-being into the very consciousness of our country. We have with us, of course, Atul also, who's worked with UNEP, so he's very well aware of the Sustainable Development Goals. Parallelly, as we brought CSR legislation in 2013 December and made it effective from the 1st of April 2014, the SDGs also got underway, the MDGs finished, and today there's a very strong convergence between the Sustainable Development Goals and CSR. You will see from Schedule 7 that among the activities permissible under CSR for companies, health figures very prominently at number 3, along with poverty and education. And a lot of companies have done a tremendous amount of work in the health and sanitation area. Coming to today's situation, it's quite amazing how much of the COVID battle has been fought on the CSR platform, and how CSR has been converted into a very prominent tool for combating the COVID-19 crisis. You will recall two particular things very importantly, that when the migrant labor crisis absorbed our country and so many of these people had to leave their city employment and go back into the villages, many companies, both private and public sector, use their CSR funds to find them food and shelter and sustenance so that their movement became that much more facilitated. The second very important way in which CSR was used as a tool was by the Prime Minister himself when he created the PM Cares Fund, where a lot of companies have now donated to swell the contributions, and PM Cares today has become at the very forefront of the battle against COVID. A third point which I wanted to make, and I don't want to go on for too long, is the fact that the Prime Minister is also thinking of having health cards for the nation, much in the way that the Aadhaar cards have been issued. And you can see, therefore, how much of CSR and health and the Sustainable Development Goals together form a very potent instrument by which we can tackle the major crisis in all the areas of health and wellness and sanitation. Across the entire country, across all geographies, across all states, the corporate world and the public sector have been stepping out to ensure that health is a priority, because at the end of the day, a nation is as healthy as its population. And we have to ensure that the message of health and wellness reaches out to the remotest, in fact, to the last person standing. And I laud the efforts of your council for all that you have done. I wish you all the very best for your awards. And I thank you again for giving me this opportunity to come on this platform. And a very nice word goes out to Mr. Sims from Singapore, whom I happen to know well, and we have worked together in the area of sanitation. So I'm wonderfully happy that you've also brought him onto the platform. Thank you.
Thank you so much, Mr. Chatterjee. Just, before I move on to our next very esteemed guest, Mr. Atul Bagai, to talk about his perspective, how CSR is helping on environmental areas. You have been a crusader for institutionalizing CSR, and in 2014-15 financial year, immediately after the rule, the new mandate was passed, we saw around 9,000 crore, CSR was being spent, with around 16,000 companies only doing that. In 2018, 19, it has been reported as 18,600 plus crore being spent, with the 24,000 companies now doing CSR, and which is, I'm sure that after this COVID trigger, it is going to expand much more. How do you feel when you see something which you have always been trying, and which you have struggled so much to bring forward, becoming such an important contributor to the social life and to the public life of people?
Thank you, Kamal. You cannot imagine how fulfilled I feel and how visionary in hindsight I feel. I remember that when I was first trying to bring in the CSR law, I became the favorite whipping boy of the corporate world. And everybody said, who is this bureaucrat sitting in an air-conditioned room in some bhavan trying to crack the whip on all the corporates? And mind you, these corporates wield a tremendous amount of influence on the the whole public policy space. And the resistance to that law was really enormous. Now I feel so fulfilled because those very corporates are now saying that now we feel that CSR has given us a real opportunity, not just to do it in the way that we used to do it in the past. And I never said that they were not doing CSR. Many were. Many said, we're already doing it. Why do we need a law? What does the government know about CSR? We are the ones who do it, and so on and so forth. But the idea of the law was not to say that this is something that is new. You have been doing it, but do it in a systematic way. Do it in a regular way. And also, please bring in transparency. Show the society, show the nation, show the country what you are doing. How much of your profits are you spending? And please take these decisions of CSR not in the back room, but in the boardroom. Use the finest minds in your company to concentrate on CSR. And that will happen only when it's a boardroom subject. The message that will pass down through your company must resonate only when it comes from the boardroom and engages the highest and the best minds of the company. So I think today CSR has established itself primarily because it is in the forefront of the thinking of our corporate leaders. Thank you.
Thank you so much, Mr. Chatterjee, and I really thank on behalf of the entire council and health fraternity. People like Dr. Hema Divakar, people like all those people who are fighting health-related issues at the forefront of our country. That people like you tried and institutionalized a tool which can really make a difference. So thank you so much for doing that, and we look forward that this movement will continue. People will invest in the health of the people to make this country healthier, more productive, and actually bring the real potential of everyone's lives. Mr. Atul Bagai, thank you so much for joining. And now you as a head of you in India, have been monitoring and seeing the country's role and responsibilities when it comes to reducing the carbon footprint, to make sure that we are coming out as a very responsible global citizen. COVID-19 has definitely put us everyone on a very different track. How do you see that going forward? India as a nation should look into the sustainability, environmental issues, and many other related issues which directly impact the health of the people and also lead to something like these pandemics. So I would like to hear from you. How do you, what guidance you would like to give to numbers of people who are hearing us and also the corporate citizens? Sir, you are on mute, Mr. Bagai. Sorry.
Yeah. Good morning, everyone, and thanks, Kamalji, for inviting me and UNEP for this very important workshop or a webinar. And I think you could not have organized this at a more opportune moment than this, considering the pandemic crisis that we are going through. And why I say this is that this pandemic, like a few others in the past, have brought to the forefront the core of the issue which you are highlighting, that while we are talking about health, we cannot ignore environment. The nexus between environment and health is so deep-rooted, and unfortunately, either at the policy level or even at a common man's level, this nexus is not understood. I was seeing the beautiful film you showed right in the beginning, and I think the messaging that has come out is so critical that it should really be outreached all over the country, because we need to understand that environment is playing such a devastating role on the health of the population that unless we are aware of this and unless we are able to mitigate the environmental degradation, our health issues will not really get sorted out. In your video, you touched upon air pollution, water. I'll just give you a very small statistic. The pollution which you are talking about, it is affecting our health through, as you mentioned, the food we are eating, or the water we are drinking, or the air we are breathing. In fact, approximately 19 million premature deaths are estimated to occur annually as a result of the way we are using our natural resources. So I think our unsustainable global production and consumption patterns, which get reflected in the air we breathe or the soil we till our food on, or the water we drink, is having an impact on health quite substantially. And these direct damage costs to health are almost estimated to be between $2 to $4 billion a year by 2030. I'll give you another example that Government of India, like the other 198 countries who have come up with a recovery plan or an economic stimulus package, each country has come out with that, which is worth billions of dollars. In India itself, it's almost 10% of the GDP, as they say. And I keep on remembering the old adage, which meant a stitch in time would save 9. Had we in the last 30 to 40 years looked at our environment degradation issues in a more sustainable manner and spent a little bit of money on sustainability, on ecosystem management, on biodiversity conservation, we would not be facing a situation where not only are we spending 10% of our GDP on an economic stimulus package, but the hospital costs, the human productivity costs, the loss of life that we are seeing in the last 6 months is enormous. And all these things, if we are going to account for, would mean that had we worked in the last 30 or 40 years on environment, we would have been spending all this money on much better issues than fighting a pandemic like this. In fact, in United Nations Environment Program, in our last assembly 2 years back, this nexus was something that was brought forward by the member states, that the countries need to work on the health and environment nexus much more deeply than they are. And this nexus, the areas like chemicals and waste, climate, biodiversity. Another big area is antimicrobial resistance, where India really needs to work hard. And certainly sustainable consumption and production. I think we need to look at these issues from the prism of health and environment. I'm very happy to say that India is also the very first country in the world to have understood at a policy level this nexus between environment and health. And why I say this is that it was only in July end, the last week of July, that the Ministry of Health and the Ministry of Environment got together to set up a steering committee on environment and health. This is really a very innovative approach and a very unique initiative which India has taken. And I don't think there's any other country that has started looking at this nexus at a policy level in a way that India has. And I would congratulate the Government of India and the two Ministries of Health and the Ministry of Environment of having taken this very, very proactive step. And I think this steering committee also comes at an opportune time when we are looking at the reasons for this pandemic, and the scientific studies that have been done for the reasons for this pandemic certainly point out to the fact that these zoonotic diseases are happening as a result of the biodiversity loss and the ecosystem devastation that has taken place in the last 40 or 50 years. And the linkage between wildlife and humanity has been brought forward so clearly in this case. So I think we should be looking at a very successful transition from a policy level towards a pollution-free planet. And this would require a very strong political leadership. It will require, as Chatterjee Sahab was saying, high-level champions and commitment, and also a lot of action at the local level. Conservation experts, I'll give you an example, like conservation experts monitoring great apes, for instance. They can be a valuable part of the zoonotic disease surveillance in communities, because community action is so important. So I think this linkage between conservation experts and the local doctors is a very important nexus that needs to be strengthened. Experts monitoring habitats also have a very important role to play. I can highlight this by an example that in 2018, livestock experts working closely with healthcare professionals in Kenya detected the Rift Valley fever and deployed livestock vaccinations and other interventions to contain its spread. And I think that is the kind of approach that is needed to address this very, very serious pandemic that has hit the whole world. And I'm very happy that the Government of India is doing a lot of work in this regard now. And ultimately, I would like to sum this whole approach as a One Health approach. This is what at a global level the policymakers are wanting to highlight, that we need to have a One Health approach instead of working in silos on environment separately, on social issues separately. We need to connect all this and come up with a holistic kind of a response. We are happy that UNEP and WHO, World Health Organization, is under this steering committee that has been formed, is working very, very closely with these two ministries to take this research forward and see how we can work together to fight this pandemic. So I would again like to thank the Council for inviting us, and it's such an honor to be sharing the same platform as with Chatterjee Saab and Mr. Sim and Bhagwati ji, with whom we are working also very closely through the faith-based organizations on these issues. So thanks a lot once again.
Thank you so much, Mr. Bagai, for your wonderful insights, and also to highlight, for highlighting this very important concept is that if we want to tackle the problems of health, we need to look into an approach of One Health and maybe one word as well, because then only we will be able to, kind of prevent the health threats which we see from multiple factors, including environment and wildlife and so many other aspects of our ecosystem. So thank you so much for that. Pranam Bhagwati Saraswati ji for joining us on this very, very important and critical discussion to understand how we as a human being, businesses, industries, and everyone need to contribute to their surroundings, to the places, to the communities we live in. You have been one of the greatest champion of that, and as I said that, the one word approach also is something, and you are a real global citizen. You came from Los Angeles to settle down in a place like Rishikesh for the service of humanity. So how do you see going forward, how we should, our businesses, our people, should take up their responsibility towards their society, and why we should keep health in the center of it?
It's such a wonderful honor to be here and to be part of this really esteemed panel. And I'm so deeply impressed, as always, by Jagran Pahel and the programs and the initiatives that the Jagran Parivar keeps taking up, because this is what we need. We need to wake up, literally. We need to wake up from our ignorance and from our illusion on so many levels that is contributing to, leading to all of the problems that we are facing today, from the COVID pandemic to environmental destruction to war to climate change, and everything is due to ignorance, is due to us literally being asleep. So thank you, first of all, to Jagran Pahel and the whole Jagran family through all of your initiatives to really keep waking us up and to be so committed to sharing not only information, but inspiration. And I'm also so deeply touched and impressed and feel so grateful to be here with the Integrated Health and Well-Being Council, to have that vision of the role of religion and spirituality in sanitation, hygiene, and therefore health for our planet is fantastic. And to be able to be here on the day of CSR awards for COVID, because so many people all over the world are seeing COVID only as an emergency. But we have this great ability to see it, not just as an emergency, but as an opportunity to really emerge and see, to emerge from the darkness, to emerge from the fear, to emerge from the stress, to emerge from our dysfunctional ways of thinking, of choosing, of living, of eating, of doing business, and to see the possibility when we actually change that into a new way of living, choosing, eating, doing business. And when we speak about health and spirituality, the root, it's so beautiful, the actual etymology of the word health is rooted not in just alleviation of symptoms or alleviation of illness, as so many people think. Health is not just about a pill here or an antibiotic there or a vaccine here, but actually the root of the word health is embedded in the word wholeness, completeness, oneness. Within the self, of course, body, mind, soul, spirit. That's what yoga is, that union. But it's also rooted in the word holiness. And so in order for us to really have full health, we have to not only be free of viruses and bacterias and fungal infections and deadly mosquitoes and all of the things that we tend to think of as that which wreaks havoc upon our health. But we actually have to be grounded and rooted in a system of understanding the self and of understanding our place in the world of wholeness and of holiness. And this is where that crucial role, of course, of our religion and faith comes in, is it helps us understand that. But tragically, people think of religion, spirituality, and faith as that which is only rooted in जीवन के बाद जब मोक्ष मिलेगा या मोक्ष कैसे मिलेगा, how after life can I be free? But actually, religion and spirituality and faith are rooted in how can we turn this life right here into heaven on earth. So it's not just about heaven after we die. It's not just about moksha after we die. It's about... Is there some problem with my sound?
There seems to be some disturbance. Can my team look into that? There is some sound coming.
So this is mainly the ये लोग investment कर रहे हैं steel sector में.
Sure. I think also I was hearing a lot of other people speaking in the background. So I'm thinking that maybe that disturbance is due to other people's microphones being on.
Yes, yes.
If the host is able to just mute everyone's mic, that would probably help with the disturbance.
Yes, yes. It has been taken care of.
Wonderful. Wonderful. Thank you. So as I was saying, we tend to tragically think of religion and spirituality and faith just as that which teaches us ki jeevan ke baad moksha kaise milega, how to have heaven after our life. But the truth actually is that religion and spirituality and faith teaches us how to have heaven right here on earth, how to live in heaven right here, right now. That's the role that our religion and spirituality give. And part of that heaven is a healthy body, is a healthy world, is healthy air, healthy soil, healthy water. And so religion and spirituality, it's essential for all of us to be working for clean air, clean water, clean soil, health in the body. No one should think that somehow these are the job of others. These are the job of the government, or these are the job just of civil society organizations or NGOs, and that religion and spirituality is somehow separate. No, incumbent in our deep religion, our deep spirituality, our deep faith, is that commitment to serving the world, is that commitment. And that's where we, the Global Interfaith WASH Alliance, have been so committed to working for water, sanitation, and hygiene, because we realized, as we say, sharir ek mandir hai. And when our physical bodies are not healthy, when our children are not able to go to school because their guts are ravaged by bacteria, when our daughters and our mothers and our sisters and our wives are being attacked by wild animals, or men who act like wild animals because they have to go out into the jungles to heed the call of nature, or they have to walk kilometers to get a bucket of water, they can't have health. They can't have empowerment. They can't have upliftment. And as a society, we cannot really have vikas. We can't have development until all of the sectors are really brought together. And so as we speak about CSR, it's so beautiful as you're focusing today, not just on the old paradigm of CSR, but on a whole new, broader vision of CSR, because it isn't just about thora sa percentage of our profits, lay low, give it to some charity. That's great as a beginning, but actually CSR needs to be a whole new paradigm of how we think about doing business in the world, that our business is not separate from our air, from our water, from our soil. It's not separate from the health of the people who work in our factories, in our companies, the women, the children. None of it is separate. And so the real now new paradigm of CSR needs to be that that's concerned not just about 2% or 3% kahadena, but actually about the full 100% of business. How can we really merge doing well with doing good? How can we merge the prosperity in our companies, in our businesses, the success there, with this vision of health that is rooted in wholeness and holiness, that is rooted in the awareness that our environment, our water, the health of our humans, and also all of the species on Earth is interlinked and interconnected. Atulji spoke so beautifully about the role of our biodiversity and species extinction with so many of the illnesses that we face. And this is what our spiritual and religious traditions have been telling us for thousands of years. We're all connected. We're all one. Today, modern science, quantum physics are telling us the same thing. There's no place that any of us ends and the rest of the world begins. And so for that, as we are in the world of business, in the world of profit, in the world of prosperity, let us realize and remember, it's not separate from health. It's not separate from water. It's not separate from sanitation. It's not separate from the air and the water. Because all of that is the present and is the future. There's a beautiful teaching, I think, by His Holiness the Dalai Lama, of how tragic it is that we spend all of our health, physical health, mental health, to accumulate money. And then we try to spend all of our money to buy back our physical health and our mental health. And if rather than falling into the trap of this tragic irony, we understood that business, that commerce, that prosperity, that industry, that companies, that all of this has to go hand in hand as one whole and holy world, then not only will we emerge from the COVID pandemic and really be able to see a new normal, but will actually prevent all of the threats that are just lining up to wreak havoc on our life. Because today is COVID, tomorrow will be another superbug, the next day will be lack of water, the next day will be climate change. They're just lining up one after the other. This is where the way to treat all of it has to be in wholeness, in oneness, in holiness, in togetherness. So I'm so touched to see the way that our Jagran Pahel and the Integrative Health and Wellbeing Council have really brought all of the different spheres together, all of the different sectors together. And this is the way together we will create the new healthy normal for all of us, for our land, for today, and for tomorrow. And thank you so much for this beautiful opportunity to be together today. And I have some very, very special news, which is that you have a beautiful and enlightening talk by Puja Swamiji that was pre-recorded last night because he has to be out today. But by God's grace, he was supposed to leave early this morning, but he's actually just on his way out now and has agreed to come and to give everyone 2 minutes of live darshan just before you play the video that he pre-recorded. So once again, thank you so much. And it's a wonderful blessing to be able to have Puja Swamiji's darshan with us for a few minutes before his words of inspiration.
Thank you so much, Sadhviji, for your so enlightening words and to highlight for our businesses that they need to find out the path of doing good and doing well. Thank you so much for this message. So before we request Puja Swamiji to appear for our audience and our panelists, we also need to take Jacksim today, because Jacksim has a meeting, and so I'll request Sadhviji, if Swamiji is there, we can have him for 2 minutes for his some live inputs, and then I can go to Jacksim before actually playing the video message which has been received by Swamiji.
डॉक्टर साध्वी भगवती जी, श्री कमल नारायण जी और श्री अतुल बगाई जी, डॉक्टर जैक्सिम, डॉक्टर दिवाकर, गौतम जी एंड ऑल ऑफ यू, मुझे बड़ी प्रसन्नता है कि अभी अभी मैं जाते जाते साध्वी जी को सुन रहा था। साध्वी जी ने सब कुछ कह दिया है। आज आपने बहुत प्यारी पहल की है, क्योंकि मुझे अभी तुरंत निकलना है। मैंने सब अपने मैसेज में दे दिया है आपको, लेकिन फिर भी इतनी बात कहूंगा। जब बात हेल्थ की है, व्हेन वी आर टॉकिंग अबाउट द हेल्थ, इट्स नॉट हेल्थ ऑफ आवर ह्यूमन बॉडीज बट हेल्थ फॉर ऑल। If our water is not healthy, if our air is not healthy, we cannot be healthy. And Corona has shown us the way. Just few weeks of Corona, now few months of Corona, we have seen how the water, the air became clear. We don't need Corona to teach us lesson. Corona has told us we are the problem. It means we are the solution. And you all together can make it happen. In 21st century, togetherness is the way. And if we all come together, we take our own responsibility, and believe me, this is possible. This can happen, and this must happen. Thank you for being here. And because I have to leave, but I wanted to see you all before I leave on the screen. And now I have one beautiful plant, a tulsi plant. I think we must pay attention to our plantation program also, everywhere and everywhere. And this is a beautiful tulsi plant for all of you, for all of you. और दूसरी बात ये है, क्योंकि धरती को हरा भरा रखने के लिए, इसलिए हरा भरा रखने के लिए हमारी आने वाली पीढ़ियां हरी भरी रहें. Because our children, our children's children, our coming generations, सबके लिए हमें सोचना है और उसके लिए प्लांटेशन बहुत जरूरी है. आज मैं सबको ये प्यारा तुलसी का प्लांट अर्पित करता हूं. धन्यवाद. बाकी मुझे जो कहना है वो वीडियो में है. प्लीज यू कैन शेयर द वीडियो विद एवरीबॉडी. एंड थैंक यू फॉर creating this beautiful moment for everyone. God bless you.
Thank you so much, Swamiji, for your very precious and blissful moment for us that you spared. And I especially want you to, you must be knowing Mr. Jackson, who is going to speak, after you. He is the man. I heard your statement saying that our country needs toilets more than temples, and he's the man who has made making toilet his mission, his worship, and that is where I think people like you are inspiring millions of people across the world to do something which is very, very critical for the health of the humanity, health of this world. So thank you so much, Swamiji, for your time, and we look forward to hear more from your video. Before that, we play the video. I now request Jack Sim, the man who made toilet as the word agenda. And Jack, thank you so much for joining us, and in this special edition of CSR Health Impact. And I know you have a meeting to attend, so before without any further delay, I request you to share your experiences of how you have been able to bring this very, very critical movement in the world of getting a toilet for every family or for every person. Thank you so much, Jack.
Thank you very much. Having seen Swamiji, Sidanand, Saraswati, and Sadhvi, it's like meeting my family again, because I go to Pamat Nistikin and receive a lot of wisdom. And we created the first World Toilet College in Rishikesh in the same ashram of theirs. So we're very happy because the message that Sadhvi and Swamiji is saying is this: cleanliness is not just clean street, clean river, clean toilet, because the moment you are able to do that, you have a clean spirit. In Singapore, we start by cleaning the street, cleaning the toilet, cleaning the river. We can drink the water from the river very clean now. But as we start to do that, it extends to cleaning up corruption in the country. Ever since 1965, we have been cleaning up the secret society, the mafia, and clean extends completely. Today, you don't have the drugs cases. That's also one cleanliness. You don't have the corruption anymore. You don't have the police asking for money. In the 1960s, they were doing that. And you don't have any more gangsters. And you, of course, have clean streets, clean toilet, and clean water, and the clean habit of people. So cleanliness is the essence of mitigating diseases. Hygiene is the cheapest medicine in the world. A toilet is the cheapest medicine in the world. Washing hands is the cheapest medicine in the world. And if you invest in prevention, you don't have to invest in cure. If COVID was arrested at root very early, you will not have the spread. The spread caused not just medical, but also economical hardship. So many people are without a job today because COVID causes the shutdown. But never in the history of mankind has hygiene awareness been as high as today. Today, hygiene awareness is life and death. And this is the time when everybody realizes what is sanitation, what is cleanliness all about. But in 2001, it wasn't like that. They can't even say the word toilet or shit or poop or pee. These are considered very embarrassing expression. Although we all go to the toilet 6 to 8 times a day, we pretend that we have nothing to do with it and we don't want to speak about it. This created a situation of 2.6 billion people not having access to proper sanitation. At that time, 2001, there were 6.2 billion people in the world. Today, there are 7.8 billion people in the world. Yet the number of people without proper sanitation has dropped to 1.8 billion. So you add the additional population and the reduction of people without access to sanitation, there is a 2.4 billion extra people who have toilet in the last 20 years. We are very proud to have broken the taboo on sanitation, made it mainstream, and bring it to the UN to create our founding day, 19th of November, as the official UN World Toilet Day, adopted unanimously by all 193 countries. And we could not have done this successfully alone. We are doing this with so many people, and many are included over here. Jagan Pahel, Rakit Benkaiser, Hamad Nikitin, Swamiji, and Satbi are all part of this effort to create this movement. Together, we also brought Akshay Kumar and Prime Minister Modi building 110 million toilets. And today, even in China, the president is now a toilet champion. What has happened is an amazing unfolding that accumulated to today, that everybody now realized the importance of toilets. Going forward, we have built the second World Toilet College in Aurangabad, together with Jagan Pahel and supported by Rakit Benkaiser. And we have, for the last 2 years, trained toilet cleaners, casual cleaners into professional toilet and sanitation workers, and placed 5,000 of them into proper job with healthcare and a protection during their work. The sewer diver has also been rehabilitated, that they do not have to go into the sewer. In this World Toilet College, we have trained them to use machine to clear the chokage. So dignity is very, very important in the worker safety. And launching this year, we are setting up a World Toilet Standard and Guidelines publication, which will take 1 year of effort, where we are compiling all the world standards of different countries and to put them together to become an authoritative reference document. I invite all the experts in India and everywhere who is listening to this conference. If you have very authoritative guideline and publication, please send it to us so we can add it and compile it into a coherent, authoritative, good guideline so everybody can learn and share and improve their sanitation. And lastly, we are now helping to promote Japanese toilet culture all over the world, because the cleanest and highest toilet culture, we scanned the world and we discovered that the Japanese have that. And what is better than they have been exporting sushi and all kind of manga culture. It's time to export their sanitation toilet culture, and the world will be better, healthier, because everyone is sharing what they know and what they do best. Thank you very much.
Thank you so much, Jack, for your wonderful thoughts. And I must say that your struggle and your audacity of hope and your positivity and then imagination that we need to have toilet for every family, and at a time when, as you say, that word was even shy of using words toilet or shit. And I think that was the seed of when we saw our Prime Minister on his very first Independence Day speech, started talking about making the country open defecation free or building toilet. I think all that started from your a very strong conviction to bring that important difference to the life of the people. So thank you so much for your time today, and we wish all the luck going forward. Also, that you are able to even provide a toilet for even rest of 1.8 billion people. So thank you so much. I'm so sorry to our, the next set of, experts and panelists also, because we are running a little late, but we'll be trying to wrap it up in next 5-8 minutes. I would request my team to play a quick, message of Puj Swamiji, which he has sent, and just try to keep it, within 3 minutes so that we can quickly take here are other panelists also and wrap up this particular session. Thank you so much. Thank you.
आज सबसे पहले जागरण परिवार के अद्भुत व्यक्तित्व जिनको मैं कभी नहीं भूल पाता, व्हाट ए मैन, स्वर्गीय श्री नरेंद्र मोहन जी एंड श्री अतुल बगाई जी, डॉक्टर साध्वी भगवती सरस्वती जी, श्री कमल नारायण जी, and Mr. Jackson, what a man, man of determination. Shri Bhaskar Chatterjee ji, Dr. Hema Divakar, Dr. Rajiv Gautam ji, and so many of you. It's so wonderful to have you for this great initiative, CSR Health Impact Awards COVID-19. In this context, we are having this beautiful webinar today, this conference today. और मुझे लगता है कि ये जागरण की अद्भुत पहल है, सचमुच जगने और जगाने की पहल है. अब इसी तरह से जागना होगा, जगाना होगा और जागते रहना होगा, और यही जीवन है. And I am glad that you are the people who have understood. This is not only CSR, this is HSR, Human Social Responsibility. And CSR powered by HSR, Human Social Responsibility. और मुझे तो लगता है कि you people have understood the life is not to have more. Having more is great, is super, wonderful. But life is not to only have more. Life is to be more, share more, give more. That's life. And that's what is needed today. That is the true purpose of CSR. Ki whatever I have, I should share for the sake of others. That's what is needed. And that's why this webinar today, this conference today, can create the power. And we can feel this power. And I give thanks to Jagran Pahal. I have seen their work. I have participated in that. We have worked together. And Jiva, even today, Global Interfaith Wash Alliance is also one of the logo partner. And not only logo partner in logo, but the logo partner with all the people, with everyone, to bring people together. That's what we have to do through our initiatives, institutions. And Jagran Pahal is very creative पहल, very creative initiative. और आज हम सबको एक ऋण चुकाना है, और उस ऋण को चुकाने के लिए हम सबको एकत्रित होना है. एंड जिन्होंने ऋण चुकाया है, जिन्होंने कुछ किया है, आज उन्हीं को अवार्ड मिल रहा है. ये बहुत बढ़िया बात है, उन्हीं को अवार्ड मिल रहा है. दूसरी बात, to me, because I was very young when I came to this life, and I was taught that life is to learn. When you learn, then you earn. And when you earn, then you return. The total life is confluence of Sangam of learn, earn and return. And this is the time to return. आपने खूब कमाया और अब टाइम आया है how to return. You have earned so much. And from that earning, through their companies or from your own life, your time, talent, technology, tenacity, through all of that, you are sharing to the community. आई एम सो प्राउड ऑफ यू. गॉड ब्लेस यू एंड आई लव यू ऑल. और दूसरी बात, छोटी सी गिलहरी, लिटिल स्क्वायर.
From Pujya Swamiji. Now I would request Dr. Hema Divakar from Artist. She has been championing the cause of women and child health, and has been, trying to bring that very, very critical intervention, especially in the area of anemia, and the other nutritional problem, as well as the primary health care problem. Dr. Hema Divakar, how do you see CSR helping you to achieve what you want to achieve in the area of women and child health?
Namaskar, with pranams to Pujya Swamiji and Sadhviji, and greetings to Kamalji and his whole team, and very distinguished and accomplished members whom I can see that galaxy being connected to our entire audience. I must confess, Kamalji, that listening to all the previous speakers, I must say that Divakar and myself are like new kids on the block. It looks more in connect with what Swamiji said about HSR, the human social responsibility. That's where we started from. And the inspiring words for us were from Mahatma Gandhi, who said, be the change you want to see. And we were so much focused and passionate about the quality care and reaching care to every girl, every woman, that we thought that why the quality should stay only in the ivory towers of Divakar's hospital. Why can't we give and, magnify it, amplify it everywhere? And then we, at that point of time, thought CSR means corporate social responsibility. We are not corporate in that sense. As Swamiji said, we've not earned a lot of money to give away, but we have the knowledge, we have the skills. Is it not something that we can give? Is it not some bit of our contribution? I fondly remember the Nobel laureate Satyarthi, who in his acceptance speech of when he was receiving the award said, the house is on fire, everybody were, panicking and running here and there. And then there was this little child who just fetched a small pail of water to quench that fire which was there. And then everybody ridiculed that child, saying, oh, how will this help? And the child just said, I'm doing my bit to avert this crisis. So we are in the same position as Bhaskar Chatterjee said, that this component of CSR in our mission to connect and collaborate, yes, we can sustain and scale the SDGs to the best possible extent, not only in our country, but in the whole of Asia. That's why the Asian Research and Training Institute for Skill Transfer, and then when Atulji said environment, we believe that women's health is nation's wealth. Why? Because the environment within the womb of the mother, that is the most crucial environment that we have. The child is first exposed to even before it comes into the environment in this world. And about empowerment, the man behind making me feel empowered is none other than Dr. Divakar. So the kind of environmental support that we should have to move ahead. And I really, really sincerely appreciate that in our endeavor to train and build the capacity of all levels of healthcare workers, which got us to the next level of seeing what really the country needs, that is the research component, and then to do the advocacy hand in hand with ISW Council, Jagran Pahal, and everybody, just about everybody whom we connect with, because people need to know what they need. And that has come to the forefront, as every other speaker here has said, that yes, indeed, the positive thing that Corona pandemic has done is to get us together with a level of introspection and reflection to do better, to make this world in keeping with good air, good water, good health, and make it reach just about everybody. Namaskar, and thank you so very much for having us on this platform. Your association has only inspired us to believe in our own potential to do as much as we can, and we will walk our talk. Thank you.
Thank you so much, Dr. Divakar, and definitely we get a lot of inspiration from you. I'll just quickly take Dr. Rajiv Gautam from Horiba. They too have been a very consistent partner of ISW Council, and this whole event of CSR Health Impact 4th edition is being supported by Jagran Pahal, Artist, and Horiba. Dr. Rajiv Gautam, how do you see CSR helping in improving the health of the nation? A very quick remark from you. I'm so sorry.
Thanks, Kamal. I think we are running out of the time. I understand it, but it has been the elite panel. So they were much better speaker than me. So we have heard it. Quickly, I said it that I would like to thank ISW Council for inviting me for this event and organizing this event. However, the Horiba has been, as a Japanese organization, has been on forefront to support this COVID time, and the CSR converting from quantitative to qualitative, which makes that money counts for the health reasons, and it's in COVID times it makes more sense for. So we also did a bit with the NGOs, Sahyog Care for You, Sharda Devi Charitable Trust, with our own plant. We have done a lot of sanitizers distributions and everything. So ultimately, we thought it that utilize our bit of our funds to convert into a qualitative need for all the people. And I would like to thank again. I don't want to take much time. I don't know whether any further speaker is there, but we have done a bit from Horiba side for this noble cause of CSR, or which Swamiji says HSR. I think that's a very good terminology. Thanks, Kamal.
Thank you so much, Rajiv ji. Thank you so much for being kind of and being precise on your remark. Thank you so much. So this was our inaugural of 4th edition of COVID-19 Special CSR Health Impact Awards and Summit, which is our endeavor to bring together all stakeholders to invest in the the life, in health, and for larger, greater dividends for business, for the country. Thank you so much for tuning in with us for this very important program. Now I hand it over to my colleague Anisha Nair Dhawan to take forward this discussion with another set of very esteemed speakers, and I'm really sorry to all of them who have been waiting for we encroaching into their time, and we would like to will try to maybe Anisha can take that program a little longer to accommodate everyone's view. Thank you so much for being with us. Thank you.
Thank you.
Thank you, Kamal, and thank you to all speakers. It was really wonderful listening in to all of you to understand how our humanity has to shine for us to solve our problems. Now, let's move on. The pandemic pause is actually a blessing in disguise. It gives all stakeholders a chance to undertake a thorough review of where we stand and also realign what needs to change. In this session, we have corporate leaders who will discuss how responsible businesses can step forward to fight COVID-19, leading the world into sustainability. The aim of this panel discussion is to bring forward how business leaders can redeploy the unique capabilities to meet society's immediate needs and offer people security and stability as an antidote to panic and fear. For this discussion, I would like to welcome Ms. Kanika Pal, Lead Sustainable Community Development South Asia, Hindustan Lever Limited, and the founder of SOCHE Foundation. We have Mr. Paresh Chaudhary, Group President, Corporate Communications at Adani Foundation. We have Mr. Ravi Bhatnagar, Director, External Affairs and Partnerships, Asia, Middle East, and South Africa, with Rakit Benkaiser. And we have Mr. Raghavendra Prasad, TS, the founder of Step One. Welcome to all of you on this panel discussion. It's really nice to have all of you with us. So the first question that comes in my mind, and it's for everyone here actually, is in the immediate aftermath of the outbreak of the corona pandemic, what went through your mind? Because a lockdown came and nothing moved. So what was the first thing that came in your mind when you thought of your projects and what should be the strategy going ahead? I'd like to hear from you, Mr. Prasad. First up, what was the first thing that came to your mind?
Yeah, the first thanks Anisha for having me on this panel, and thanks for IHW for this initiative. And yeah, so the very first thing actually when during around the mid-March that came to our mind was the fact that there would be a lockdown, and this and that would mean that access to healthcare would suffer. And there are a lot of people in this country who have multiple lifestyle diseases which are non-COVID, and we knew that they are going to have multiple issues because there would be a big focus on COVID, and also the fact that if everybody starts going to the hospitals even for COVID, then hospitals could become centers of spread. So we wanted to avoid people who don't have to go to a hospital to not go to a hospital, and get access to a doctor sitting from their home. And this was when we thought we'll use technology and the power of humanity, which Swamiji was talking about, to come together in times of crisis. And that's essentially what turned out into what is Step 1 today. Step 1 basically is a free telemedicine platform that is being offered via the government channels to the citizens of 13 states. We are right now live in 13 states, taking 60,000 calls a day, powered by about 7,000 doctors on the platform. It's completely volunteer led, and it's one way by which we have seen the general public has come together to support the government, and in turn through the government support this other citizens in having equal access to or easier access to healthcare. This has also been supported by so many corporates across the country. In fact, I should thank a couple of gentlemen on this panel. Mr. Paresh Chaudhary, his organization has been so kind to support. Adani Group has been so kind to support Project Step 1, and they continue to support us. And also would love to thank Anshu and Gunj and their team of volunteers who have helped us, in working with the government in Bihar and Karnataka. So, Anshu, thanks to you and Gunj and the volunteers, we are actually looking forward to helping the citizens of scaling our operations in Bihar and Karnataka. Thanks to Gunj.
Right. So we'd like to welcome Anshu of Gunj on this discussion as well. But Mr. Chaudhary, let me come to you first. Mr. Raghavendra Prasad has thanked you for all the effort that you have made. But at the time when the pandemic broke, were you concerned about your teammates, their health, as well as the beneficiaries of these projects, for them to, not just deal with what they're dealing with, but contract the disease?
So, Anisha, I think I've been on a panel earlier to this with the same group. And I always say this, that, why do human beings and people wait for a pandemic to happen for us to realize our own power of consciousness and a power of empathy? And I think people who've woken up very late because pandemic hit us, and that's when all the shit hits the roof. I think, the word empathy and the help and the support that you have in your DNA, whether it's an organization, Swamiji mentioned about human sustainability indexes, or whether it's a PSR, a personal social responsibility, everybody has that in their minds. I think every human being has got some goodness in their hearts. When pandemic breaks out, the goodness increases or decreases, depends upon how messy situation you're into. But I think just to answer your first question, the first thing that came to our mind as a group and individually, all of us at the senior management level, was an increased opportunity to ensure that we use our current systems of our DNA, our empathy, to ensure that our people are safe, that the people around who work for us, our employees first, is something that we took to a very large extent. Our projects on sustainability our projects on water conservation, our projects on social empowerment, our projects on environmental safety, something that we took it to a different level. In fact, this is one company that's never taken up jobs, never taken away one job, not cut their people's salary. In fact, to people who are earning at the mid-level or the lower level, say a CTC of X and Y, we've actually given them increments this time. We've given them loans to people, interest-free loans of employees, so that they can sustain at this point of time. But what we have really realized is that the purpose of business is to actually do good all times. Not to just do good, but also to make sure that we also are seen to do good in our stakeholders. I spent, Kanika is here with me, I've spent many years with Hindustan Lever and Unilever in India, and also in our corporate office in London. And I can tell you the sustainability stuff that Unilever does, not now, for the last 3 decades. So if when pandemic hits you, it's just business as usual. You just kind of, extend a little extra hand of help. Whether it's Raghavendra here, whether it is our self-help groups in Gujarat or in Jharkhand, where we got these, we made about 500,000 masks from these people so that they can make a living. We had a skilling institute of Adani Foundation that we actually help people to have vocational training and earn some money there. We put a lot of money on training, on skill development. So I think the entire ecosystem came together to make sure that not just our people, our families, but also the people that we touch in their lives, whether it's community, whether it's plants around them, are not just safe, but they are progressing. They feel secured. And I think that's something that where Gautam Adani led that, along with Tushar Adani, who's the foundation chairperson, led. And you'll see all our 20,000 people on the ground doing so much of work, not just helping other NGOs and other people to do good work. But we opened up a hospital in Bhuj, for example. That's the largest district. Kutch is the largest district in India. We opened up our entire hospital for COVID patients free of cost, and we treated a number of them. So I see a great opportunity. We saw that people feel blessed that there is a great employability and a great employer brand came up. People around you felt blessed that we are working together in partnerships. And I think your real DNA comes out when there is crisis. So, so I'm very glad that we could do that. And I know a lot of organizations have done that too. Right.
Thank you, Mr. Chaudhary. So Mr. Chaudhary is the group president, corporate brand custodian at the Adani Group, and he enlightened us with what the company has been doing. And he sees this as an opportunity to do even more. But Mr. Bhattagar, I wanted to understand from you, at any point after the outbreak of the pandemic, did you feel a need to reassess what you were already doing and do something else? Maybe not for the long term, maybe in the near term, but stop doing what you were and do something else. Mr. Bhattagar, you're on mute. Can you just unmute yourself?
Yeah, thank you so much for the question. So what you have asked, and I feel really privileged. Like today, I'm there in mid of all distinguished people, and was glad to hear Swamiji also. So the question is very right. Like there's some short-term strategies what we have changed amid COVID. The most important thing was in my career, in my previous roles, like I have responded to Ebola, I have responded to H1N1. I have responded to MERS in Saudi. So it was a very new thing for for all of us, and first of all equipping myself and my teams on COVID-19. So first was basically our own training through the institutes, online trainings and other things. We did that. We entered into the partnership with the GE Healthcare in India. We trained all the frontline health workers. There are 7,000 people which we trained with the GE Healthcare. It's the first time Dettol has partnered for the online training in India specifically, and similar models are being used in the other parts of the world which I lead, which happens to be Asia, Middle East, and South Africa. The short-term strategies in terms of the training was the first need. Second is preparedness. Third thing is basically like responding fast, responding quick, and being a health organization, you can't take the decisions like mavericks. So generally, people talk about FMCG sector and talk about speed over perfection. But here, like, thinking more, learning more, seeing more, and using the data in such a way, like, all the data transpires into something which can be used for the last mile benefit. And from our social programming with the World Toilet College, what we do with Jacksim, or our hygiene impact bond, what we have, which is first of the hygiene impact bond in Asia Pacific. So how we are saving the lives. So we have changed practically a lot of things, and a lot of speed we got into our systems. We also saw the power of people on ground. We realized, like, a little bit more push and little bit technology can help all of us. We use significantly blockchain as one of the technologies in our health programming on ground during the COVID. We use the artificial intelligence algorithms to reach out to the populations, which are the key populations in terms of HIV positive groups in India, as well as 1 million plus LGBTQ plus populations in India. So we have served all of them. We have gone very fast. We were able to do the work very fast, and definitely there are a lot of learnings. And during this time, we have also started assessing the social return on investment on our programs, pre-COVID and post-COVID, how things are changing, and are the indices changing, and what is bringing more change. Are standalone health interventions resulting more social return on investments, or hygiene or nutrition, or sanitation? So what is the right mix? Because this is an opportunity to test a lot of things, because you are actually in the you have very less time in hands, but you really need to perform. And a lot of modeling will also come out from this, and we are very sure, like how we have taken Detol Banega First India, from India to Bangladesh to Sri Lanka to Pakistan to Nigeria. In the same way, a lot of work from India, what we have been doing, being India one of the biggest markets, we are going to take it to the other parts of the world. Thank you so much.
All right. Kanika, Mr. Bhatnagar has shown us how technology has also come to the rescue to do things very differently. But at the outset, when the pandemic broke out, there was a lockdown, people couldn't move around. What were the challenges that you foresaw will come immediately?
Thanks, Anisha. Thanks for having me. And I think most of the points have already been covered by Paresh and Mr. Bhatnagar as well. But I think the point in addition that I really want to highlight, Anisha, is that, at the end of the day, it's a pandemic which is taken over the world. The human race has been affected. So the humaneness in the entire body of work that we do, I think, became even more urgent, right? So we had all our programs which anyways have been running, and I don't want to talk about what is it that we've done. It's all there in public domain, what Unilever as a group has done, and anybody who's interested can really read up on that. But for us, the most important part at Unilever always has been safety. And like Paresh rightly said, with or without the COVID, for us as a company, safety is paramount. So even when the pandemic hit us, across all our programs, how is it that we keep our people safe was the first and foremost thought that really engulfed us. Here, of course, the challenges were very different. So you're talking about the regular business as usual or work in community related safety, plus safety against an issue that we're still trying to understand. Research is still not there. You have so many unanswered questions. People are walking back to their villages, the villages where we are working. Suddenly there will be an influx of more people. The disease burden would go up. Eventually, the natural resources would possibly at some point of time, start getting strained. These are questions which need answer even as I'm speaking here right now with you, So to paint a brush and say that, we found all our answers would be incorrect. It is work in progress. While we continue to support the government efforts, while we continue to do what we know how to do best, which is we're in the business of making soaps and sanitizers and so many other important essential FMCG products, right? And we distribute it to be it the affected migrant laborers or in hospitals, to police workers, etc., etc. But the real question is that how do we help people in these villages get back to a sense of normalcy. And what is that sense of normalcy? I just want to actually bring in my own personal experience here as well, Anisha. And I've been for almost the entire part of the last 6 months having delivered my baby and on maternity leave. And I know bang in March, I had to give vaccination to my baby. And being in a city like Bombay, I struggled. I had to find pediatricians with a lot of pain who could actually administer vaccination to my small child, keeping everything in place as far as safety measures were concerned. And at that point of time, my heart went out to those women who were pregnant and walking back for kilometers to their own villages because we could not provide them with the basic needs that cities promised when it came to daily wage laborers or people in villages. How would they vaccinate their children? What about basic nutritional needs? What about basic facilities that are needed? Anshu is here on the panel. I know Goonj and a lot of other organizations have done some phenomenal work in howsoever much we may say we've covered a distance, but I think there is just so much more to be done and we've really just scratched the surface. Better part of the year is still left and we're still dealing with real issues coming out of some of the areas where we continue to operate. So I think it's been a learning curve for us. It's been a huge learning curve for us. We are still trying to see how we make our programs more relevant. All the livelihood efforts that we had so far was done when people could come to our centers, for example. Now, with dependence on technology going up, you also need to ensure that there's infrastructure in the house of a person whose daily wage is not as high as getting a high-speed internet, affordability of a high-speed internet. So how is it that you marry technology and your curriculums or some of the programs that you're running, be it on nutrition, be it on hygiene, in a way which makes sense for people at the grassroots level and that they are truly able to reap the benefits. So I think we saw in the initial phase an influx of corporates really rising to the occasion and giving a lot of free soaps, sanitizers, food kits, safety kits, etc. to people, their beneficiaries, to migrant laborers. But now it's reached a stage where we are reevaluating our programs consistently with our partners and trying to see how is it that we make it most effective, perhaps for the next 2 to 3 years, if status quo were to be maintained.
Okay, so that's really a long-term view on how to realign things. We have Anshu with us. Anshu, I'd like to come to you because the panelists who have spoken before you have really appreciated what Goonj has done. My question to you is that in the immediate aftermath, did you see any reluctance, any fear from your workers, from your donors, from people you interact with? Because at one point of time there was so much fear that people just wanted to shut their doors, stay inside, do nothing. Even if they felt that they had the means to go and help people, they were too paralyzed by fear. Did you face any such situations?
So thank you, Anish and Kamal, for organizing this. And Raghavendra, I'm a big fan of you and Shuchin, how silently you guys are really doing it. And also, Kanika, the way you touched upon the right chord, to be honest. I'll talk about it. But just to answer your question, Anisha, I think I'm very proud, very, very proud that I belong to this sector, the development sector, because this is one sector and the common citizen of this country. The way I can surely say that in the first few months of this disaster, if the kind of hunger deaths which were possible, this disaster, and that didn't happen, the large part of the maximum credit really goes to the common people of this country, the ordinary citizen as they are called, not the celebrities or leaders or whatever, but the common citizen of this country. I'm saying it very upfront as an ordinary citizen. And also the social development sector, the NGOs who didn't have a PPE kit, who didn't know what is the risk all about, and how they really, really came out. I mean, we started operating from the lockdown days itself after taking permissions from people. The the stores or the centers which otherwise have 200 people, 100 people, because Goonj is about 1,000 people all across the country. We were only operating with 20, 30 people, but they were staying there. They were operating from there because we had to respond to the thing. Also, I would say I'm so thankful to the government, simple, small or big hospitals, and some people in the private sector who really worked with them. So I know that there was fear, but I also know that at least in many sectors, people just responded. People were not worried about their life. We know a lot of individuals, we must have heard the stories that how they were actually cooking at 5 o'clock, using all 2-3 gas burners, using their cookers and serving whatever they were able to. So this country or millions of these citizens who suffered majorly, who were forced to walk hundreds and thousands of kilometers, they actually were taken care by the common people. And I know that how my team responded to it, because we work in like 25 states, and we literally had to reimagine the institution. We had to reimagine the work, because otherwise our model is hub and spoke. And this time the hub and spoke didn't work that way, because you literally have to go to the spoke part and the last part and do the localized purchases and all that. So in the last 4-5 months, we've done almost about 3 million kgs of dry ration itself, which we never did. We purchase almost 1.7 lakh kgs of vegetables from the local farmers, which we never did. I mean, otherwise people know us for cloth and all, which is a wrong perception, but still. So I think the team really coped up well. And then I'm just hoping that this is how it remains. I am the only person in this huge team which was affected by COVID, and so I went through this entire journey, and then the after effects. So for me personally, these 2.5 months have been very complicated. But I'm so proud that even the myth about Goonj in the market, that Goonj is equal to Anshu Gupta, is broken, because Anshu Gupta was either hospitalized or on the bed for some time, but the organization really did well, and I think it did well because of the courage of people, not just because of the resources. It's exactly because of the courage of people. Because a lot of people had a lot of resources and they didn't operate. A lot of people didn't have resources and they operated. I mean, COVID is very simple story.
Right. We are very glad, Anshu, that you've recovered and you're here with us to recount your experience and how your team has really outshone. Mr. Prasad, I wanted to find out from you, because Kanika also said there is a learning curve. And, if the situation is what it is, like status quo stays for the next couple of years, how will you realign what you do next? What will you prioritize so that your goals are there, but you also take care of immediate needs?
Yeah, so I think that is certainly challenging. I think we are definitely in a VUCA world. VUCA used to be in the corporate jargon, but now we are faced with the reality of a volatile, uncertain, chaotic, ambiguous world, and operating under this circumstances is a challenge. I can only recount what we have done and how we have learned in the last few months that we've been in existence. One of the key advantages that Step1 as an organization has is the fact that we are already in 13 states, and now we'll go live in 4 more states. So each state is very different, and each state has done a few things right. So we have a natural advantage of learning from the best practices of one state, and working with the stakeholders in the other states, and trying to implement those best practices. One of the things that also happens with us is the fact that different states come to us with different problems to solve, and then we go back to other states and say, is this a problem with you also? So is it worth for us to solve it for you as well? And the virus itself, as there are various stages, and the problems in stage 1 that governments deal with, or the citizens deal with, is very different than the problems in stage 2 and 3 and beyond. So, so the so to a certain extent, we can do a lot by learning from other countries who have gone through this. I think Italy is a fantastic example, though of course the situation in Italy and the infrastructure there, the immunity levels of the people there are different, and India is different. We at least get some patterns which we can plan from. So one of the things right now that we are currently like what worked in Delhi, for example. In Delhi, we were doing mostly helplines, and we were working predominantly with people, citizens with pre-COVID pre-COVID with COVID-like symptoms or contact, and helping them to figure out whether they should get tested or not. But Delhi showed us, or the Delhi government and the situation in Delhi warranted us to start doing COVID positive management. And we started that sometime in May, early June. And now, 6 out of the 13 states, we are doing COVID positive management, because we believe that helps in flattening the curve, and it helps in arresting the spread of the disease. Similarly, we started with plasma management again in Delhi, and now we are doing plasma management in other places, plasma donor management and matching, because we believe that it saves life. Like going forward, we're already working on a vaccine rollout plan. How can technology help in identifying the right people and the places, and what is the right infrastructure that is needed for us to make when a vaccine comes out, the rollout of that smooth, and how can we work and empower and augment the government resources in actually making that happen. So I think a little bit of thinking ahead, a little bit of understanding of how the scenarios planned out in other countries which have already done well in terms of arresting and flattening the curve, and also learning from various other states in India. So in fact, one of the things that we have tried is to get IAS officers or or bureaucrats who are basically at the forefront of fighting corona in various states together on a call like this to share best practices. It's something that we have done a couple of times, and it has really helped. Like if you look at the trend in India, the virus is certainly spreading more east, and the northeastern states are some of the most vulnerable states in the country, because the healthcare infrastructure is extremely poor. So we are best in trying to only arrest, and we probably need to go back there and create almost like a lockdown like scenario where the very strict entry and exit procedures are followed. So working with the bureaucrats and making sure that they are aware of these strategies is and continuously helping them learn what from what we have learned are the few things that we could do.
Right. Mr. Chaudhary, have you drawn up a plan for the next few months or couple of years should situation remain the same? Mr. Prasad mentioned that they are planning on a method to deliver vaccines to those who may need it once the vaccine is ready. Have you realigned, reassessed, thought about what more things you could do should this situation remain in what you're already doing, what the goals that you already have in your CSR plan?
Anisha, like any progressive organization, there is always a forward-looking 5-year plan that we do. And I think these kind of situations are dovetailed in the risks and the vulnerability factors, right? And luckily for us, we'd also taken the pandemic in view 2 years ago, saying that what if something else like this happens? So while we are going to focus and increase our focus on business continuity with empathy and safety as a prime driver, what we do. So if you look at safety focus and the acceleration of business continuity, it does two things. It makes sure that your people who work for you, the partners, vendors who are associated with you, the communities that you are working with, and the foundation, for example, or Adani Group is across the country. Foundation operates in 18 states now. But we are also reaching out to states where we are not operating as a business, right? So that is the empathy. But as we increase business continuity, you'll ensure that the economic activity begins, right? So the vendors, suppliers, their families, their associations, their organizations start getting involved in this whole trigger of economic activity. So one is, I think, the purpose is to make sure that we not just create a very higher social fabric, but we also make sure that there is economic activity, because I think that's where the problem is, right? I think the amount of sanitizers that everybody has distributed, we can actually import sanitizers to China right now. So we need to make sure that people get cash in their hands, they get jobs, their employment increases. And that's the thing that we're doing. Obviously, as a part of foundation, like everyone here and a lot of people outside, whether it's NGOs or corporates, when the vaccination comes or whatever, we'll do our part of doing that to make sure that the last mile, the person at the last mile receives our support. But I think business continuity is important. We have accelerated our sustainability value creation process that we started many years ago, but we've accelerated that. So our focus on planet, our focus on prosperity based on equality and equity. Today we're looking at Black lives on one side in the US, the tribal in India, and that still continues. You look at whether you look at Australia, Aborigines, and these are the things that actually make people not equitable. And the equality doesn't happen. So we also going to look at that more aggressively, because that's when you make it up. Because everyone has a right, Anisha, everyone has a right to live a life of employment, of having a fulfilled life at the end of the day. The degrees might vary, but there has to be some dignity in labor, dignity at work, dignity of relationships. And I think that's what we all should focus on. And we're going to accelerate that, and we are focusing on that at this point of time.
Right. Mr. Bhattacharya, you spoke about how you're using technology to figure out what is working best. What are the different things you can do? You mentioned using blockchain as well on the ground to understand what works best. So can you give us an example of how you made technology work for you? Can you explain to us, common people, how technology is going to help? Because technology has backstopped us during this pandemic when we were stuck at home. So how is this working for people who are working in the field as well? It'd be nice if you could explain that. Mr. Bhattacharya, are you there with us? I think Mr. Bhattacharya is on mute.
I think he has an issue with his internet. You can move on.
Okay. We'll move on and speak with Kanika. Kanika, you were saying that you yourself faced real trouble, in vaccinating your child, and you started thinking about everyone else and how they are getting impacted, who maybe less privileged than what we are. Now, what Anshu told us how common people have helped, and there were a lot of fears that many people will die. The food supply, the supply chain had broken. People would starve. The farmers would not have anybody to sell their goods to. Seeing what has happened, the picture that was painted in what really happened. What are you penciling in for the next few months and years? If you also feel that the status quo is going to continue, do you think there's only going to be an improvement is there a chance that we could see some of those predictions come true?
Anisha, I am a diehard optimist, to be very honest. And I think this is an unprecedented crisis, which has really shown us how, if we all put our might together, we can really do wonders. And that is exactly what happened during the lockdown. At the end of the day, we were all really practicing lockdown, right? I don't think there were many people who flouted the lockdown rules to begin with. I think what is very important to understand in this entire crisis at the end of the day is that there is a disruption which has happened in the way we were continuing to do a lot of things, even in the social sector or the environmental sector. For some time, there will be aberrations. I know in times to come, perhaps the investments in environmental sector, there is a projection that it may actually undergo a dip, and there would be a surge in the healthcare sector. Telemedicine, for example, Raghavendra is really talking about it, but that's something that is really the need of the hour, because we need to first, cover the health of our people. That's the very basic. And then move on to the other things as we get back to the economic activities really taking more precedence, people getting back to their routine, the life journey really taking on. But I think the real innovation would come about when people across sectors would continue to collaborate. The common man's role in that is very important. I think every time there has been a great solution, somewhere or the other, it's either the nature which has been an inspiration or a common man's advice which has been inspiration. One of the examples that I can quote is probably a viral video which has gone across, where oranges sorting is done by a man just putting, two parallel lines and at a, not exactly parallel, but it's sort of converging in front, and there are boxes underneath, and he just rolls the oranges and sorting automatically happens in different boxes, because according to the size, the oranges keep falling in the boxes. Probably the point that I'm trying to make is that empathy and a common man's wisdom so far were things that we would really talk about, but now we're seeing a lot more of it in action. And that is something that we need to continue to remind ourselves. At Unilever, we have a huge program which is on nutrition for pregnant and lactating women. So it's not that suddenly there was a eureka moment and I realized that, my heart goes out to the common man. Of course, I mean, that's something that you do as part of your job and otherwise as a person. But essentially, you start to revisit some of the programs and the metrics that you're applying at the end of the day on the effectiveness of these programs, because of the challenges that the pandemic really throws at you. So if I have a healthcare worker who's going to a pregnant and lactating woman in giving her counseling कि ऐसे आप आपकी डाइट ये होनी चाहिए, आपका बीपी क्या है, आपका वेट क्या है, आप पानी कितना पी रहे हो, suddenly if she's not able to make that physical contact with that woman, how is it that she's going to reach out to this woman? Will the phone counseling be enough? Do you need to have a face-to-face chat, and therefore, the digital medium comes into play? On another angle, moving away from the corporate, within my own foundation, we work a lot with potters community, and artisans have been greatly impacted. The livelihood of some of these basic rural communities have been impacted, like, we don't even realize it. Abhi Diwali aa jayegi, it's just around the corner. Everybody would say, buy local, please buy diya. And then, we don't even realize what's gone behind in the last couple of months. These people have not been able to practice their normal course of life or their normal, livelihood avenues. How is it that they are helping each other? I know of potters with very limited means. Pocket mein 5,000 rupees hai, but they are helping out other potters who are earning less than them, so that uske paas khane ko at least ek waqt ka khana ho, even though, he may or she may not have 3 waqt ka khana. So that's the basic difference in the way we as people have come together. And I completely agree with Anshu. The common man has a huge role to play. We've had COVID warriors, not just from the hospitals, but from the social sector and the environmental sector, who have not even thought for a second, not even blinked an eyelid. I'm still sitting in the comfort of my house. I'm nursing my child. But there are people there who are COVID warriors who are still out there from day one and have been serving the community. So it's not about numbers. It's not about the millions of people we've reached out to. It's not about, how many hand sanitizers we've distributed or how much money we've parked for COVID relief. It's really about, again, the human angle in the entire picture. And I hope that 2 years, 5 years, 10 years down the line, we do not forget the lessons that COVID has really taught us.
Right. Anshu, I'll come to you. Now, you also said that the common man has helped a lot. And Mr. Bhatnagar spoke to us about how technologies also help us plan things better. How can you make this movement, sustainable, to keep the common man involved? They feel, okay, I've done my bit, I've made a contribution, let's move on. How do we involve them into making this a sustained initiative from them? How can we expand this further?
So, why should only common man or common person really work on it? That's it. That's my question. तो मैं भी बहुत ऑप्टिमिस्ट किस्म का इंसान हूँ, लेकिन बहुत दुखी हूँ, क्योंकि मुझे लगा था कि वायरस जो है ये हमारी सोच पे थोड़ी चोट करेगा. But if I review it after a few months, मुझे लगता है कुछ ऐसा हुआ नहीं है. I mean, I still see hundreds and thousands of people who are in the position of authorities who have the money and the power, their language is not changed, their lenses are not changed. मतलब उसमें 10% के बदल गए हो तो उससे कोई मतलब नहीं है. आप हमेशा पहले कहते थे कि डिजास्टर ईस्ट और नॉर्थ ईस्ट में होता है इंडिया के, अब तो डिजास्टर साउथ में भी होता है, हर जगह साइक्लोन और फ्लड्स आते हैं. फिर आपने कहा कि डिजास्टर सिर्फ एक पर्टिकुलर कम्युनिटी को बिलोंग करता है, उनको ज्यादा इफेक्ट करता है. तो आई ऑल्सो एग्री कि हाँ इफेक्ट तो एक को ही करता है, बिकॉज मोस्ट ऑफ अस, लाइक इफ आई टॉक अबाउट माई सेल्फ, I was, by the grace of God and people, I was so privileged that I at least had a separate room and washroom to handle it. और हमारे बहुत सारे दोस्त, वो जो बड़े बड़े प्राइवेट हॉस्पिटल्स की लूटमार चल रही है, 15-20 लाख रुपए कोविड में जो लग रहे हैं, वो अफोर्ड कर पा रहे हैं या किसी तरीके से कर लेते हैं. बट दैट if you have to go to those hospitals, even the common people will have to shell out the same money, and even after selling their land and livelihood and livestock, they will not be able to do it. तो मुझे लगता है कि यदि हम common people already बहुत burdened है. Fine, today if I talk about the development sector people, हम में से किसी के पास में इतनी बड़ी social securities नहीं है, कोई बैंक balances नहीं है, और joblessness सोशल सेक्टर में इतने मैसिव लेवल पे हुई है, बिकॉज द मनी इज टोटली गॉन. इवन द CSR मनी इज गोइंग in distributing food. Even today, instead of talking about mental health, instead of talking about so many other burning issues, unfortunately the way we treated this disaster, हमारे यहाँ आज तक इतने महीनों तक, and Kanika is a joint, is an example of that, कि हमने suddenly जो हमारे हॉस्पिटल्स फुल होते थे और हमारी कैपेसिटीज नहीं थी उतने पेशेंट्स को हैंडल करने की, हमने सडनली सिर्फ कोविड को एक डिजीज बना दिया, उसके अलावा कोई डिजीज बची नहीं इस देश में. तो वैक्सीनेशन तो बहुत बड़ी बात है, मतलब कैंसर से लेके डायबिटीज तक, मलेरिया से लेके कोई भी डिजीज बची नहीं, और वो सबसे बड़ा सफरर कॉमन लोग हैं, क्योंकि दे कांट अफोर्ड अ प्राइवेट हॉस्पिटल टू गो देयर. तो व्हाट आई एम ट्राइंग टू से इन नटशेल, दैट I think people who are in this panel, we are not only privileged, but we also have certain kind of authorities or decision making on money power or whatever power we have. It's extremely important to relook into the entire episode. That, और ये बात मैंने जब same, Kamal was also there, he was in one of the panel, and I'm actually literally repeating that, कि हमें ये बैठ के सोचना पड़ेगा कि ये जो लाखों लोग हैं, मिलियंस ऑफ पीपल, ये उठ के गए क्यों? हमने ऐसा गलत क्या किया? मतलब हम 20-50 साल के अंदर एक बेसिक ट्रस्ट किसी इंसान को नहीं दे सके कि तुमको यहाँ रह के तुमको रोटी मिल जाएगी. रोटी चाहिए ना उसको, और तो कुछ नहीं मांग रहा था वो इंसान. और वो इतनी बड़ी सोसाइटी पर, लीडर्स पर, कॉर्पोरेट्स पर, बिल्डर्स पर, सोशल सेक्टर पर, किसी पर बंदा ट्रस्ट नहीं करता और 1000 किलोमीटर अपनी फैमिली के साथ चलना शुरू कर देता है, डिस्पाइट नोइंग कि कुछ नहीं है. Do we still remember that, or we are just in the helping mode कि migrants हैं और migrants को बस हम खाना पीना खिलाते रहे? Are we really talking about the social factor? Are we talking about that building that trust? Are we talking about the relationship of equal? या हम दोबारा से बसें भेज के उन लोगों को वापस बुलाएंगे और लेबर लॉस से छेड़छाड़ करेंगे और फिर उनको फर्दर एक्सप्लॉइट करेंगे और फिर CSR करेंगे या सोशल वर्क करेंगे? आई थिंक दैट्स अ क्वेश्चन which many of us need to really answer if we want to solve this problem. तो कॉमन पर्सन ऑलरेडी बहुत मैसिवली अफेक्टेड है, उसके बाद भी कॉमन पर्सन ने बहुत कुछ किया. नाउ दिस इज द टाइम फॉर द पीपल जिन्होंने कुछ इस देश में अच्छे कॉलेजेस में सब्सिडाइज एजुकेशन ली है दबा के, जो बड़ी बड़ी यूनिवर्सिटीज में पढ़े हैं, IIT में पढ़े हैं, दे नीड टू रियली रिस्पॉन्ड much more than the people who are earning 10-20-25,000 rupees a month. This is time for them to pay back, not give back, but pay back. And जब तक वो लोग नहीं करेंगे तब तक नहीं हो पाएगा ये, क्योंकि ये डिजास्टर बहुत बड़ा हो चुका है. हमारे देश में ये सिर्फ हेल्थ रिलेटेड नहीं बचा है, ये ऑलरेडी बहुत सारे इश्यूज चल रहे थे. पॉवर्टी बहुत बड़ा डिजास्टर है, एंड as Paresh also said, मैं तो बहुत शुरू से गूंज का शुरुआत ही इस बात में हुई थी that why do we wait for a disaster in a world where we don't need a disaster, half the population does not need a disaster. तो एक लास्ट पॉइंट ये है अनीशा, हमें ये समझना पड़ेगा कि हम जो इस सेक्टर के लोग हैं, चाहे वो CSR में हो चाहे डेवलपमेंट सेक्टर में हो, what we have been trying for years is that we are trying to bring people from minus to zero. मैं तो डेवलपमेंट बोलता नहीं हूँ उसको, क्योंकि डेवलपमेंट 0 से 10 होता है. बट हम में से बहुत सारे लोग अभी इसी चीज से जूझ रहे हैं कि माइनस से जीरो तक कैसे लाएं. जीरो मीन्स कम से कम 2 वक्त की रोटी हो, 2 जोड़ी कपड़े हो. What we all need to understand is a very sad reality that a lot of people have now gone back to minus and maybe further deeper. It is extremely important for us. वो बंदे जिंदा रहेंगे, ऐसा नहीं है कि वो जिंदा नहीं रहेंगे, क्योंकि इस देश में तो कर्जे पे लोग जिंदा रहते ही हैं. साहूकार जिंदा रखता है आपको और आप जिंदगी भर उसका कर्जा चुकाते रहते हैं, तो आपका घर वही झोपड़ी की झोपड़ी रहती है, फिर अपना जून जुलाई में बाढ़ आती है, बह जाती है. That's the life cycle of millions of people here. All of us in this panel and beyond, who can afford a good house or whatever, I think we need to understand that the large part of the society has gone much deeper, and we need to bring them back. That needs extraordinary efforts by a large number of extra people, not just the traditional people who have been doing this. I'll stop here because, as I said, that I'm sad and I'm angry. For sure, I'm optimist. तो मैं अपना optimism जिंदा रखूंगा. But it needs a huge force to bring back people, exactly at least to the level of 0 or +1. Thank you.
Right. Ravi is with us. Mr. Patakar, Anshu has raised very important things. People look at COVID as a health problem, and people are saying now, corporates should look at doing healthcare in their CSR, spend more on healthcare. But this is a huge social problem, and it has exposed the inadequacies everywhere. Now, since CSR reaches out to a lot of people, and you mentioned you're using technology to realign things. Do you think there is way by which you can share some of the data that you have culled out using technology, your interaction with the end beneficiaries, on how things can change, and perhaps get the government to also realign a few things to focus on not just pandemic response but also a social infrastructure that should keep everyone safe? Can you hear Ravi?
Yep, it's better now. So sorry, my connectivity is a bit poor today, Yeah. So very interesting question indeed. And I would like to, add something to Anshu from Gund, what he was saying, before I give you this answer. So I myself actually went through this whole COVID problem, was admitted for around 20 days. And when I became okay, I had to, I got a, invite to donate the plasma. So I met this family who wanted the plasma from me. So I was asking, so how come your patient is in such a difficult situation from last 4 days and you're not able to get plasma? I was very surprised and shocked to hear. They said, we are Muslim, therefore the donors are not giving us the plasma. Because you have to actually put whom you are donating to. So that was something I was very moved, what's happening to us. We are talking about equity, we are talking about equality, we are talking about rich, poor divide, we are talking about a lot of things, but the basics needs to be corrected. If a pandemic, in pandemic situation, if we are talking about caste, religion, etc., minority, majority, this looks like, we as a country has not evolved enough. And I myself has, donated the plasma to this, old gentleman who's Muslim from Aligarh. I feel myself so proud, when 10 donors have rejected him, at least I went there and I agreed to give. And somewhere there is a problem in the social fabric also. Under CSR, we need to talk more about the nation building, and in the nation building, somewhere we need to actually talk about reducing the inequalities of various kinds, various shapes, and we need to try to bring some equity. So now coming to your question, what you have asked. Indeed, the question is very interesting, but my submission is, a lot of things are evolving. We are all trying to give some short-term solutions, but long-term we don't have evidence to a lot of things right now.
evidence in terms of treatment, evidence in terms of taking care, evidence on the mental health issues. We're all trying to fix the problem, and most of the times, like, it's a band-aid solution and it's not the long term. Sorry to say, like, I'm seeing some biscuit brands giving biscuits because they would like to feed the hungry. I'm seeing some other brands giving some health supplement, etc., etc. But India is a country which is full of diabetics. It's a diabetic capital of the world. So I'm seeing, like, people are giving anything and everything what they have and not taking care of what is actually needed. So we need to be very, very careful what we are giving, how we are giving. Does it have some negative connotations? Should we evaluate giving sanitizer versus soap? Should we evaluate giving single-use masks, three-ply masks to some other N95 masks? So what we are giving, how is it beneficial? So somewhere more evidence-based programming is required, and a joint collaborative effort is required, so that there is a better mix. So as I have some experience of dealing with 3 other pandemics earlier in my earlier avatars, so I also think this is a time to think about zoonetics. So how the zoo animals are transmitting the all epidemic to us. So there is a book called Spillover. It's very beautifully written, this book. We need to actually have a look on that book whenever we get the time and see, like, how the life will be changing. This is one of the big pandemics what we are seeing. But that book particular give the references of next 15, 20 more pandemics which will be happening in the coming decades. Are we ready? Is someone taking note of that literature? And there are a lot of warning signs which were coming globally. And sometimes corporates have the knowledge, sometimes NGOs have the knowledge, sometimes UN has the knowledge, sometimes CBOs have the knowledge. But somewhere in the whole process and in all transitioning, the role of the community-based organizations and the role of de novo CBOs, the de novo community-based organizations, we all forget. And we think WHOs of the world know the best, corporates know the best, and NGOs know the best. What is happening on ground, in the periphery of a CBO, no one understands that. We have witnessed immune compromised people who are already HIV positive, hepatitis B along with HIV. That's a huge population in India. Who is doing so? I am not hearing anything about that. What's happening? We are talking about migrants. We are talking about people moving from one place to another place. There are more vulnerable populations. When we particularly see that, World Bank.
So that is what I'm asking you, Mr. Bhatnagar, that you're on the ground, you get real-time data. But the people who are making the decisions are doing it because somebody told them, and some government had a good experience, and some institute thinks this is the best way forward. So this is what I'm trying to understand. Because you're on the ground, you see what is happening. You're using technology to collate the data. Can this be shared so that we have an effective strategy? Can you share this with the past to be?
We are very much open to share. We're very much open to share the technology, framework, what we are using. And moreover, like, this technology also helped us to reach out to the NRCs, which are the nutrition rehabilitation centers, where, we were seeing basically the MAM kids, which are moderately malnourished, are, returning back to the severely malnourished kids. And, we have seen plenty of them during this COVID time. So how you use this blockchain as a technology in the nutrition rehabilitation centers, and, helping those nutrition rehabilitation centers to pull their, to pull all the things, pull those strings together, so that you have you can deliver well in time. Then giving the conditional cash transfers. Parents, migrants, last quintile population has no money, no resources in this period of 3 months. So how you equip them with a bundle of package so that they can take their kids and themselves to the last mile, can use the money which is there parked in the CSR budgets of the organizations like us and many others, and they can get the benefit. And through the blockchain technology, you use all the pie which is basically earmarked, and you can actually say, I have been able to save 50,000 children's life or 1 million women's life through my interventions, and you get support from a lot of them. When we started, we were alone. Now I have around more than 120 organizations alone in India, and globally I have more than 300 organizations who are supporting my cause and I am supporting their cause, because we have shared knowledge platforms and shared technology. So you are very rightly saying we are very much open to share the technology, and we would like to use it further so that all the results, whatever the work we are doing, can be ascertained in a particular fashion, and we can use further algorithms, and we all basically spend our monies and our dollars and our mullahs to actually save lives. And the measurement should be only two. One is disability adjusted life years, and second is a social return on investment. It should not be how many people reached or how many, how big is the campaign. Actually, how many people's life we are able to save. So that is the key indicator from any pandemic, not any other indicator at all. Like, people say we have empowered these many people, we have empowered these many communities. We need to have the hardcore data, which says, God, boss, I have saved 50,000 lives. This is the evidence. There are 20 people in the blockchain mechanism who have validated this particular process. So we need to be more process driven. We can do, and we need to choose the hotspots. Choosing hotspots is also very important. There's a lot of learnings from the polio program. There's a lot of learnings from, this HIV program through the targeted interventions. There are other learnings from the this smallpox eradication program. We need to see those. Also, with our work in Gorakhpur, which we did on the Japanese encephalitis. So there are a lot of learnings which we have gathered. Can we see the national health programs, and rather than having a socialistic approach, we actually move to more data-driven approach, and we use something called, social anthropology, as well as we use, other measurement indices and and the projection modeling to make our work more solid, rather than just, beating around the bush. Thank you.
All right. So there are, ways that we can go forward, and let's hope that each other's experience will also be one that we learn from and can apply in the projects that we use. Thank you so much, Mr. Chaudhary, Anshu, Ms. Prasad, Mr. Bhatnagar, Kanika. Thank you so much for sharing your experiences with us. Let's hope this pandemic is that wake-up call that makes us change from just handling a pandemic to, in fact, improvement of our society and upliftment of our society. Thank you so much for joining us and sharing with us your views on how everybody is dealing with the COVID pandemic. I'm going to hand it back to Kamal, who's now joining us to take us through the next discussion we're getting into.
Thank you, Anisha, and thank you, Kamal, again. I'm signing off, but again, great panel. I like the passion which Bhatnagar went in the last. He was like a India-Pakistan war. So I really love the passion. And thanks for donating the plasma to a Muslim guy. I think that's where the humanity starts. Exactly what Anshul was saying. So thanks again, and Kanika, great seeing you. Sorry from Levers, and Raghavendra will continue to work together. Thanks again.
Thank you.
Thank you so much, Pareshji. Thank you so much, Raghavendra, Raviji, and also Ansu for accommodating our request and joining on this panel. It is always wonderful to hear from you. I'm hearing Raghavendra first time, but the kind of work he's doing, multiple states, is wonderful. So thank you so much. I would just say that I think what sums up the whole discussion which we had in the last 1 hour and since morning, that we need to look into the human to human responsibility more than corporate social responsibility or any other kind of responsibility. We as a human being are responsible to the people who are around us and the whole planet which is around us. So thank you so much, all of you. We'll move on to our next session, and with this, so it has been a wonderful day, and the last two sessions where we got to hear some really, wonderful experiences, thoughts, and also, real life stories, which are moving enough to bring our priorities right. So with this, I'll start our next session. So, for our audience who are joining us now, I'll just, give again a brief introduction. So good afternoon, everyone. I'm Kamal Narayan, CEO of Integrated Health and Wellbeing Council, a not-for-profit social impact initiative which is promoting health for all. Welcome to this special and last session of our 2-day-long 4th CSR Health Impact Summit and Awards. We had a host of legendary thinkers, activists, conservationists, of environment, health, and human being, along with the domains of corporate social responsibility since morning. This session is about taking CSR intervention beyond ailments, investing in preventive health for a greater demographic dividends. The CSR mandate under the Companies Act identifies health as an area where enterprise can contribute. However, in most cases, the term health brings an image of the hospital or doctors to our mind. There is no denying the fact that they are important constituents of the healthcare ecosystem. However, discussion on how we can stop healthy people from getting sick and work on eliminating the factors that cause diseases is often missing from this discourse. This is an important area that can significantly impact the CSR initiatives, and also these initiatives can bring qualitative and quantitative impact on that, as being highlighted by other panelists since morning. So what are businesses doing in this area, and how can they contribute more in ensuring people do not fall ill and need a hospital? To discuss this, we have an esteemed panel with us today. I'll introduce our first panelist, Dr. M.R. Rajgopal. He is the chairman of Pallium India and director of Trivandrum Institute of Palliative Sciences. He was one of the founders of and pioneer of Pain and Palliative Care Society in Calicut, in Kerala, which made palliative care a popular movement in the state, and also he is leading that movement across the country to ensure that equitable, empathetic care reaches to everyone, everywhere. But Dr. Rajgopal has also been an esteemed jury member of 4th CSR Health Impact Awards and helped us evaluating some of the work of real impact. We also have Mr. Ajay Khanderia. He is an entrepreneur and evangelist who is also the founder of Grameen Healthcare. Grameen is the first healthcare system that works exclusively towards providing and extending primary healthcare services for the last mile of rural India and to our farmers. So thank you so much, Mr. Khanderia, for joining us. He has joined us from, I think, California. So I believe we are, troubling you in the odd hours. Maybe. So, but thank you so much for joining. We have Dr. Anupama Shetty. She is the general manager and head of CSR initiative at Narayana Health. She is an alumnus of Tata Institute of Social Sciences. Dr. Setty's experience as a physician, administrator, and researcher shaped her perspective towards CSR and focuses on scalability and sustainability of interventions. We also are privileged to have Mr. Vijay Sethi. He is a CSR veteran and is the Chief Information Officer, Head of Human Resources and Corporate Social Responsibility at Hero MotoCorp Limited. He has been recognized as the CSR thought leader and also won numerous CSR recognitions and awards. I'm sure the wonderful work which his group has been leading and the kind of values they live for is definitely making a lot of impact on our society. So thank you so much, Mr. Sethi, for joining us today.
Thank you for inviting me.
Thank you. Without much delay, because some of our panelists would also have to be, we were running late. I'm so sorry, we are running late since morning because there's so much to hear from our speakers, which we could not stop ourselves or limited in time. I'll begin with Dr. Rajgopal. Dr. Rajgopal, you have seen India's healthcare from a very, very close quarters, and you have seen where do we lack? We lack in providing equitable healthcare, empathetic healthcare, and to people where they need it. How do you see that, apart from ensuring that they get healthcare on time, how we can make sure that we get a better environment around them so that they are not falling sick or they don't require healthcare that often? Dr. Rajgopal.
Thank you, Kamal. Am I audible?
Yes, sir. Very much. Thank you.
Namaskar, everybody. So pleased to have this opportunity. Kamal, to answer your question, I will have to start with what health is. I mean, no personal opinion. The official definition of World Health Organization of health is that specifically stating that it is not only absence of disease or infirmity, but it is physical, social, and mental well-being. So that puts your question right into the framework of what healthcare should be. But arising from that, there is another question. Is that really talked about? Does a healthcare system accept responsibility for physical, social, and mental well-being? Now, to answer your question, what CSR initiatives and health system as a whole needs to do about it, we are not talking about somebody else. We are talking about all of us. I am going to be ill someday. I have only 10% chance of dying a sudden death, like you are. 90% chance is that I'll go through a prolonged illness before I die. Okay, with COVID and everything, if you want to make it 10 to 15%, I have only 10 to 15% chance of dying a sudden death. Now, when I am ill, okay, the process has started. I have a little bit of hypothyroidism, I have a little bit of diabetes, at least pre-diabetes. I mean, the health system has to help me to live with this. Now, is that what the health system does? Yes, up to a point. How much? How far does it go? If there are these millions of people in that kind of health-related suffering, how much of that is actually addressed? There are three problems, Kamal, and I'll stop with that. The first is an error of omission. Health systems do not treat suffering. If I have cancer, I have 75% chance that I will be in pain. I may have other physical symptoms. They need to be treated by palliative care. Palliative care reaches less than 2% of the needy now. 98% chance. Especially if you go to the big hospitals, just ask, do they have palliative care? Do you have oral morphine for treatment of pain? And they will give you the answers. 98% of people do not treat pain and suffering. Take any Western European country or USA or Canada, Australia or New Zealand, it is done. Take Uganda. They are doing so much better than us in treatment of suffering. Sub-Saharan African countries are improving. Now, that's the error of omission. We do not treat pain or suffering. An error of commission. I said I have 90% chance of dying a rather slow death. I mean, towards the end of my life, take the last few months or even sometimes years, what should be important to me? I would ask you all sometimes, so I'm so sorry to talk about this, but you're also going to die. Where would you like to die? When you are close to death, what would be important for you? If you do not know this, I'll tell you what will be important for you is to have a few people, loving people around you. And today, anybody with any money in the pocket dies alone, imprisoned in an ICU, hooked up to machines, unable to move by themselves. Family allowed to visit but not touch for 5 minutes in the morning and 5 minutes in the evening. Sorry for scaring you. This is the reality. I'm open to being challenged. One more error of commission. 2015 article published in British Medical Journal by 3 Indian authors. 55 million Indians are pushed below poverty line by catastrophic health expenditure in 1 year. 55 million is more than 4% of our population. That's another of commission. These are things which have to improve, Kamal. Uh, we have to improve. You said preventive and promotive. Promotive has to include palliative care and rehabilitative care. Without that, that promotive care is incomplete.
Thank you so much, Dr. Rajgopal, for bringing out this very important aspect of role of palliative care, and also how we are ignoring sufferings of 98% of the people almost who need it. Let me go to Mr. Ajay Khanderia on it, and I'll come to. So let me just bring together the perspective from the people who are working in the area of health, and then I'll go to Mr. Sethi to understand that how corporate world look at these problems. So, Mr. Khanderia, wonderful to see you after so long, and. So Dr. Rajgopal highlighted about the chances of that each one of us will have or will develop some kind of diseases, the kind of world we are living in, which will lead to a kind of slow death process. If I can be so openly start talking on this thing, which is normally not talked about. You are working in the area where many of these diseases, many of these sufferings, and at the same time, many of these deaths are ignored and not included in our healthcare system. These are our villages, our farmers, our marginalized people. How do you see that we can help them have a healthier life, a WHO definition style life of having a physical, social, and mental well-being, and what it takes to achieve that in the rural areas?
Kamal, great pleasure seeing you again. After the government of India banned me from coming to the US, cancelled all visas because of COVID, it's very nice. So first of all, I want to take a minute talking about what Dr. Rajgopal said. It is so true. Western world is so developed in palliative care and subsequently hospice. It is not funny. You know that my passion is rural healthcare and for the underserved. So 5 months of being isolated in San Francisco area, which I feel very privileged to be in, we have started a couple of businesses in California doing exactly what Dr. Rajgopal talked about in the US. We are providing rehabilitation and palliative care in rural California. Believe it or not, California has rural parts. And there is an incredible amount of learning there. We find out what do they want in the last few days. They have the right music playing for them, the right type of lighting there. So they make life comfortable on our exit. And that's very, very true. So Dr. Rajgopal, hats off to you. I think we need to do more of this. Now coming to India, where I think we have all criticized what we don't have in India, but what we must realize is that Ayushman Bharat is probably one of the most ambitious healthcare projects in the world. I don't think there's anything that comes close to it. So I think India has taken a huge step towards secondary and tertiary care. Unfortunately, the weakness in the system is primary care. 93% of the country requires primary care. 55 million people went into poverty because of primary care problems or because of secondary tertiary that evolved from primary care. COVID is a primary care matter. 99% of COVID patients require primary care. And what breaks my heart is that while there is so much talk about farmers this, farmers that, I have the largest primary care network in rural India, which is privately owned and for profit. I do not have a single test kit for COVID. Test kits have not made it in rural India. So what happens is if a farmer sees the symptoms, he has to get on a bus, drive for 2 or 3 hours, spend 300 rupees of his money to go to a hospital to get checked. Maybe the test is free, but it costed him $300 to do that. And if he doesn't have COVID, he'll come back with some other disease because he's gone to a hospital where there is infection. This can be so easily detected at the primary center. And they can be isolated, quarantined, given treatment, etc. at the primary center. 1% of the population needs to go to a hospital, not 100%. This is where we need to focus on. And I'm not even talking CSR. I'm just talking all of us individuals who are privileged can bring in their own influence and do this. We did not wait for CSR. We did not wait for the government of India. We did not wait for grants. We said, this is what we believe in. This is what we want to do. And we started. Of course, there was no pandemic when we started. We were focusing on chronic illnesses, diabetes, hypertension, neuropathy, retinopathy, this, that, other things. But coincidentally, as luck may have it, the biggest impact we will have will be for infectious diseases, whether it's COVID or whatever follows. I think we can all put our minds together and try to get tests done, try to get education done based on sanitation, improve immunity, social distancing, this, that, the things in rural India. If this pandemic reaches the rural markets of India, reaches the farmers, no power on the world can stop it from spreading like wildfire. We need to do something about it. The government needs to help us do. We are working with Digital India guys, but I think Niti Aayog and so on and so forth needs to work on it. This is my bandwagon. This is my passion. I have written an article which is published in Forbes India about the lack of support for primary care in COVID. I think it's in the issue that comes out on the 20th or 25th or 28th. It's about, we're talking about independence. The country has been independent for a long time. Our farmers are not independent when it comes to healthcare. We need to do something about it. In my own little way, I'm doing it, but I think all of us need to do that. Very simple. I'm a very simple person. There's no technology. It's just simple. Touch, feel, and provide them what they need.
Thank you, Mr. Khanderia, for bringing this up, and then also highlighting that how during the time of COVID-19 also the rural India, as you have been working on it, has largely been excluded in our mainstream healthcare system. I'll go to Dr. Anupama on this, and Dr. Anupama, you are representing one of the largest brand which is providing, I think, tertiary and secondary care. How do you see that these kind of numbers Dr. Rajgopal is putting out, that around 55 million people are pushed to the poverty, and which is going to be even worse a situation during this COVID-19 period. These numbers are going to be much higher. Despite that, we have schemes like Ayushman Bharat or government working extra mile, but at the same time there are a lot of those collateral factors or social factors which can take much more toll in terms of when it comes to poverty. How do you see that we can try to stop patients progressing from primary care requirement to secondary to tertiary, which actually kind of adds up to the expenses and to the complications, and which ultimately also converts into loss of productive days, life, disability, and multiple things. So how and what is your view, and how NH tries to make sure that primary health system is strengthened?
Thanks, Kamal, for having me on the panel, first of all. And I'd like to thank you because, I'm really honored. I'm sharing the panel today with some of the luminaries from the field. And I feel so honored. And, I just heard from Dr. Rajagopal as well as from Mr. Khanderia, and I completely agree with them. So I handle two parts of the program. CSR at NH is not only about rolling out programs, but I also do a lot of crowdfunding, and we raise funds through philanthropies and corporates for the treatment of underprivileged patients. So I've seen both parts of the story. So in terms of preventive healthcare, it's very true. We are a tertiary healthcare group. Correct. But the fact is, Dr. Shetty has always felt that why is this young man even coming to me with a heart attack at this stage? Why didn't he know that he had hypertension, or didn't he see the signs even earlier on? The fact is that there's no health-seeking behavior, or it comes on, very late when you're already in the damage control mode. So for him, it was very important that we kind of move the needle to the population rather than having, we have e-health centers, telemedicine clinics also. But he felt we should go back to the communities. And that's why we started a population-based NCD surveillance program. Just to give you a context, today, obviously, all of us are talking about COVID, and COVID is, a pandemic of the century. And it's been an X-ray of sorts, which is, showed in such sharp focus the fractures across several systems. And that's so even for the public healthcare system. For us, what we in fact wanted to work on was how do we enhance the public healthcare infrastructure? How do we contribute? And what we saw was that there was a large gap in the non-communicable diseases program. There is a huge chunk of diabetics, and several speakers who have spoken before me, panelists who have spoken, have talked about the catastrophic expenditure which has come because a lot of diseases have evolved to a stage, when the treatment costs have also risen. I'll just give you some absolute numbers. We have around 5.87 million people suffering. The mortality rate is around 5.87 million people dying because of non-communicable diseases every year. Of that, 4 million because of diabetes, hypertension, respiratory diseases, kidney diseases, 1 million owing to cancer. And this cancer burden is just going to double. And so against this, what we said is, let's go back to the communities. We started doing breast cancer screening, cervical cancer screening. We've also put in place, what happened is, when we went out to the field, we saw that there was a lot of fear though. If I were to just do a screening camp and say, I'm trying to do a screening camp for breast cancer, cervical cancer, cancer itself is a fear-evoking word, so there were not many people who would also want to even come to such a camp. And then we realized that there are certain social determinants of health. And coming from this, for us, it is so important that we also deal with the psychology of people. How do I reach out to these people? And so one of the things which we put in place is we said we'll do a general screening for you all. And that's how we came about to doing a complete, the entire set of diseases, which is diabetes, hypertension, anemia, vision, respiratory disorders. So we started doing, we have a small kit, and within 10 minutes, we're able to screen a person for a range of conditions. Along with that, we do an oral cancer screening, breast cancer screening. And this has been going on since almost, I would say, 2 years now, before COVID came in, obviously. But so the people get screened for a whole range of conditions. It's quick, and since it is data driven, we have our own software and hardware. So there's a lot of data accountability, transparency. But at the same time, you would feel that, okay, what's so different? There are so many groups who are doing this, because healthcare screening is something which obviously a lot of groups do. But where I think we kind of went for further a little was we started a CHAMPS program. We felt that can we have students as agents of change? Oftentimes we see that parents are convinced more by their children than by us. If I were to tell you that, you're hypertensive, you need to keep going for a regular checkup, it's not going to happen. But if your daughter or son were to tell you, it would have a little more impact, And so what we did is we took in high school children. We trained around 90 government high school children as a pilots. And we told them, we trained them how to record the blood pressure. And these children in Bangalore itself, in a rural community, they were able to measure the blood pressure of almost 2,000 adults. 30% of them turned out to be hypertensive, and half of them they didn't even know that they were hypertensive before that. So as a small pilot, we just felt that, can students be agents of change? Because like I told you, the social determinants of health are extremely important. Health-seeking behavior is very low. And how do we engage people to take charge of their own health? If nothing, I think the COVID pandemic has also taught us that. Simple things, hand washing, guidelines, like, respiratory etiquette, social distancing. I mean, these are very simple tenets. You would agree. And so what it has, I think it has taken a pandemic to bring out certain, very basic tenets which need to be taught. And we're doing that too. So what I'm trying to say here is that in terms of the non-communicable diseases program, we've tried to definitely go back to promotive preventive services. And I'm so glad to share even with Dr. Rajagopalan that we even invested in a mobile palliative care program. But there have been challenges right now in the face of COVID, especially the non-communicable diseases program has gone completely off track. It has been derailed. Even the WHO recently had come out with a survey. They've done a short survey across, I think, 155 countries. And as per that survey, 90% of the staff have been deployed for COVID-based, COVID duties. 50% of the people are not coming in for any kind of a checkup. Referrals have been delayed, surgeries have been delayed, any kind of preventive health checkup has been delayed. And I think what is going to happen is, along with the COVID pandemic, we already had a silent epidemic going on. We're going to see, a doubling of the figures going forward. So I think right now there has to be a clarion call. We need to take up NCD in a really robust and very aggressive manner forward. Having said that, I'm so sorry, Kamal, but I'm so sorry. I have an audit committee meeting coming up now at 2:00. I would like to take your leave with your permission.
All right. We are running late. We understand.
Yeah, Sethi sir, Khanderia sir, Dr. Rajgopalan, it is wonderful to see you on the panel. I'm so sorry I can't stay on further. Thank you so much for this opportunity.
Thank you so much for joining. It is important that you shared what you are doing, and it's good to hear that. Mr. Sethi, we heard three representatives of healthcare at different level, focusing at different aspects of and part of your lifespan. Your company moves the rural India. I think the rural India is moves on the wheels provided by
world. Not just rural India, everyone.
Okay, the India moves on on the wheels provided by your group. We heard about the palliative care which is lacking. We heard about how our farmers are suffering at time of COVID-19 also, and we also heard about this growing NCD burden. There is another one major aspect which is causing massive deaths and disability in our country, and that is road accidents. This is the area which your organization I saw doing something. How do you see road accidents cause deaths and devastation, or even that is also leading to poverty? It is taking lives on a very, very productive time. Your company being an automobile, how do you try, and what sense of responsibility you feel in trying to mitigate that? And if apart from going beyond awareness and education, are you also trying to provide some kind of healthcare? Because what I see in rural India, maybe a one accident, a person may have to be taken for 100 kilometers for the first trauma care. So how do you see that?
Thank you, Kamal. I'll just maybe make a minor modification in what you initially said, that I heard three representatives. I'll say I heard three experts. So it was not representative. Dr. Rajagopal, Mr. Khandoria, and even the way Dr. Shetty spoke about. I think these guys are experts, and I really like the way Dr. Rajagopal started with, which is basically absence of disease. I'll come to road accident in a minute or 2-3 minutes. But before that, I think the key point is from a CSR perspective, can we really work to ensure, number one, especially at and that's what we are doing, especially at the youngster level, to ensure absence of disease. And if we get into absence of disease, there are a couple of areas on which we are working on. There could be many areas, and we have experts who can talk about that. One is the basic hygiene and awareness. Are the people, especially in rural India, and are they really aware that the disease is caused because of lack of hygiene? So that's where we are getting into. For example, lot of schools would not have even toilets for girls, or no toilets, forget girls, anyone. So, and that does create a lot of unhygienic conditions all over. So we are actually in all government schools where we're working, we are putting up a lot of toilets, starting from that basic. We create a lot of sessions where we are telling these people the importance of washing your hands, sanitization, hygiene. I think moment your habits get at that age, only then you can become a person who's much more healthy as you grow in the age. That's what our thought is. The third piece, which I think Dr. Rajagopal rightly said, is the disease is also the absence of mental, social, and physical well-being. That's what Dr. Rajagopal, you said, if I remember correctly, all the three things. So from a mental perspective, we really work with many of these guys to ensure that the stress levels, while we think stress levels could be higher at persons who are maybe 25, 30, 35, but the reality is in today's time, because of all the pressures and everything, even students who are much, much younger, even at 14, 15 years, they are stressed out. So how do we ensure that their stress levels go down, doing yoga classes and things like that? How do we ensure that their physical fitness is there? So we are working with various schools to build up their sports infrastructure. So I think our work from a CSR perspective is to ensure that at the ground level, can we ensure that the health is really better for these guys, their social health, their mental health, their physical health is better. The infrastructure is there, which is hygiene. And also there's a mindset that they really think that hygiene is much more important than many other things in life. So I think that's how we are working on this. From last point before I get into road safety, also from there are a lot of people who think that their mental health also gets into, because they are maybe, for example, let me take a specific example, especially or those people who could be in remote villages. A lot of times, if they are having some bit of disease or any such thing, their mental health also takes a backseat because they don't know whether someone will help them or not. So we are helping a lot of specially abled every year, and also running a lot of medical vans which goes into all these remote villages, which can help them in ensuring that at least there's some doctor, there's some medical person who's helping. So that also helps, apart from other things, on the mental things. Now coming to road safety, I think the point that you said is fantastic. I really love that point. If I go back to our own vision of CSR, so we have a greener, safer, equitable. Safer, which is road safety, is the most important, one of the key pillars of that. I don't know how many of us would know, but on Indian roads, there's a death every 4 minutes. There's a death every 4 minutes. And these are all reported deaths, actual maybe higher, but every 4 minutes there's a death. Roughly around 140 to 150,000 people die. And our own motto, mission is that even if we say, for example, even if I'm able to save 10 lives, or those 10 guys and their families and all the immediate surrounding, the amount of good work that we have done is fantastic. Now, if I go back, what we do is, you rightly pointed out on the awareness scheme, but we started with what Dr. Shetty also said. I think it is the children who are really going to change the behavior of elders. So we target the students, we target kids. So the kids, and my favorite example is one of those kids whom we had trained. Next day when he was, Gurgaon, Delhi area, he was taking a U-turn near one of these Rajiv Chowks, which is a wrong U-turn he had to take to go to Sector 10 or something. So the kid said, Papa, don't go over there. I was told that this is unsafe. I think that is and his father told us this story. So this is the behavior change that we are working. Second is, we run at a lot of places traffic training parks. We also run a lot of campaigns on social media, on TV to educate. But most important out of those is, right from the beginning, can I change the behavior and change the driving pattern of individuals? So in various colleges, various institutes, IT, especially women institutes, we run a program called Ek Pehal, where we teach, free of cost of course, students how to ride a two-wheeler and how to ride it safely. Apart from that, we run programs for various other corporates and others to run. So moment your driving behavior is right, chances are that the number of accidents would go down. So it's a 360 degree that the driver, the pedestrians, lot of other activities, we work with various police authorities to ensure that things are much better. But I come back to the last point, where you rightly said that if we don't focus on road safety, there could be a lot of injuries apart from deaths, and those injuries then lead to the people who are not really firm enough to either contribute to the society or they themselves become kind of, they think they are burdens on themselves, and that creates a problem of mental health for them and their family members. So if we can really focus on that, I think as group, as society, all of us can really contribute to ensuring that the well-being of the society is there. That's how I see, and road safety from that perspective is very, very important. Thank you.
Thank you so much, Mr. Sethi. And I also know that you also have to go early or at least at 2 o'clock for a meeting. So I'll have one more question before I go to my other panelists. The one of the focus of our discussion and our effort is always to look at the preventive side of it, and we believe that good air, food, water, and good healthcare, which includes all that which is needed, right from right screening to the timely intervention to palliative care, everything has to be there. Good air is one important aspect, which is very critical, and keeping in mind that the health environment nexus, which is growing and becoming complicated every day, and also I think somehow also has the possibility of the kind of pandemic which we are seeing. Your organization, I have been seeing, doing lots of work on tree plantation. Almost, I think, 2.1 million trees you have planted.
Absolutely right.
What drives, because this is something that is definitely a green cover which you are covering, but what I believe is it's having, and many such drives will definitely have some impact in, kind of changing the balance between what we are, kind of putting into the environment, and in terms of pollutants, and what we are doing to protect it. What philosophy your group follow, and what long-term health impact you try to achieve, if you have really thought about from the health point of view?
Yes,
so
you're right.
Kind of long-term health objectives or goal you pursue.
Absolutely. Kamal, I think what you said is right. As I said, our vision is greener, safer, equitable. The health part is equitable. The safer is road safety, and greener is where we focus on the environment best. And at a point in time, all of them really get into one single thing. So that's where we started, and we go back to 2015 or so, when Delhi had this fantastic thing of distinction that we are the world's most dirty capital from a pollution perspective. And that really led to a lot of issues from health perspective. A lot of people have all the respiratory and other problems. Kids had their own issues. And that's where we started with putting up trees. So we've been putting up, we have as of now put in 2.1 million trees, as you rightly said. But for me, there are two things which are more important. One is, of course, it has a huge health benefit, but there are two other benefits that I see. Number one, whenever we plant these trees, there are lots, maybe till now, maybe more than 1 million people would have come in and helped us in all these things. So the amount of awareness that it creates, and when these people go back at their own place, they are either planting a tree, or if a tree is there, they just water the tree and take care of trees, or not really pull it. So that is how it is helping the entire environment. The second is, while planting is important, I think what we are also focusing is on the survival of trees. So as of now, our survival rates of these trees are roughly around 90-91%, and we really take care and kind of audit each plantation that we have done. That also leads to huge. Coming back to why the group's philosophy, our philosophy has been driven by this fact that we must give back to the society from whose resources we generate wealth. So that's the key tagline of our philosophy. All our plants, for example, even on products, our products are one of the most environment-friendly products. All our plants have manufacturing locations, have all these certifications required for the platinum certifications for LEED and all that. In fact, our factory, if you come to our factory, we don't call it, so Neemrana factory, we don't call it a factory. We call it, garden factory. It's not a two-wheeler factory. Because the amount of greenery that we focus on, because we believe that if the persons who are there, if they are healthy, the entire society would be healthy. And the last piece I'll say is it's not just about air. We also focus a huge on water, because water is another thing which again we consume and which could lead to a lot of issues from a health perspective. So from water and air are two major focus from our environment perspective, and which finally contribute to health.
Thank you so much. So I'm sure you are doing your bit in when it comes to conserving water and air, along with providing other preventive aspects and eventually educating training. Thank you so much for your wonderful work. And I will go to now Mr. Khanderia, and we'll come back then to Dr. Rajgopal. Mr. Khanderia, so we
Can I take your leave, Dr. Rajgopal, Mr. Khanderia, Mr. Kamal? Thank you very much.
Thank you. Thank you, sir. So Mr. Khanderia, equitable is the word which comes from both Dr. Rajgopal and even our, Mr. Sethi was talking about equitable. What is the status of equitable care when it comes to rural India? Is that word really exist in rural India?
Should we even ask that question? I mean, the only time there is anything equitable with our farmers is during elections. I mean, I actually welcome all of you to come for a visit to rural India and see the plight of people there. They are petrified about the disease. All of us are privileged. If unfortunately we were to get that, there will be 16 people running around, 20 phone calls made to everybody, including Devi Shetty and so on and so forth. This VIP needs treatment. In rural India, they don't have a choice. There is no special room with a special bathroom that they can be quarantined in. If one person has it, everybody in the family and the neighborhood will get it. Second of all, he has to work every day to put bread on the table. He has no choice. So he's petrified. If he gets the disease, his whole family will get wiped out. His older parents, his older grandparents will get wiped out. So the only thing that we are able to do, which is equitable, is go educate them on sanitation, provide them products that are immune building, guide them, wear a mask, wash your hands, sanitize, and that's about all. And I really have no words to express how bad it is out there. And we are very fortunate that our poor people have huge immunities built from living where they are. So it's not the pandemic has not spread there. But if it does, I don't know if we can do anything about it.
How do you see that? How corporates can play a role? We are talking about how corporates can actually enhance the health outcomes, strengthen the system, and then also work towards the prevention. Right now, let's say prevention is one definitely an area, but at the same time, the disease management or stopping the spread of COVID-19 can be one very focused area and maybe more tactical as of now. How do you see what's the game plan you suggest for corporates if let's say Hero Group wanted to do something for these villages which you
Well, there are three parts to it. First part is education. That's an easy thing for all of us to do, is to tell them what it means and tell them that about the facts and not fiction. And tell them that probably less than 1% of them will be having morbidity, and so it's really not as dreadful as the social media has made it out to be. Uh, Educate them on sanitation, on hygiene, and stuff that Dr. Shetty mentioned is like, wear masks in public and if you have symptoms and all that. Second part is if we were able to provide the COVID testing kits in rural India, we are at least able to identify the patients so they can take more care. We are not doing that today. There is very few PHCs or private institutions that are doing any kind of testing there. Third thing is what we are already working on is we are talking to Pfizer and some others to provide vaccine whenever the vaccine comes out to the higher risk communities, people with immune compromised systems or people over the age of 40. And Pfizer, at least Pfizer is talking to us about setting up an infrastructure on how to how to get the vaccine across to the poor people, and so that will be part 3. I think start with education and testing are the two things that corporates can do. We are doing our small thing, but there's a lot more to be done.
So I think that you are putting up that, I think, a network and infrastructure which can be possibly supported by the corporates. Dr. Rajgopal, mental well-being and social, physical well-being are the areas which you feel are need to be ensured for everyone at every level. Mr. Khanderia is trying to diagnose, or let's say screen people at the village level, and prevent diseases or catch them early as possible, as much as possible. How do you see the efforts like this can also help, including palliative care, which you stand for? And what can be the possible role from corporates and society in ensuring that this equitable care reaches to as many people or to everyone everywhere? Sir, you are on mute, I think.
Sorry, that's a big question, Kamal. Kamal, I think you can do more than any of us. Sitting in that chair and taking on the role of advocate, one thing that you need to do is to wake up our collective conscience of this country. Dr. Khanderia, Mr. Khanderia talked about the suffering in the rural areas. I mean, that's not hidden. We should have seen it. We have successfully avoided thinking about it because we get away with it. That's the only thing. We get away with it. They don't know what to demand. They don't demand, so we get away with it. That's primarily one thing. More advocacy for people who have been denied healthcare, like the rural population, all the elderly, all women. How much of rights do they get? We are talking about equity. Children, people of different sexual orientation. How about those with disabilities? We talked about the people who are, one person being killed every 4 minutes. For every one of them, there must be 10 people disabled for life with injuries and still living. Yes, advocacy. I hope you will take it as your task to be an advocate for those denied their health rights. Secondly, come on, I am not arguing for palliative care. I am arguing for equitable health care. Palliative care for me is only way of providing that health care, reduction of suffering, as much of well-being as possible. I'm not saying that CSR money should go only to, a lot should go to palliative care. Instead, what I'll say, strengthen the hands of people going out into the community. 2018, the World Health Organization's Astana Declaration, declared in the capital of Kazakhstan, calls for universal health coverage, which is certainly promotive, preventive, curative, rehabilitative, and palliative. That they should reach people where they are, when they need it. Where they are. That's in the villages. You are building your healthcare palaces in the cities, are expecting them to come there in time. We are arguing for their health-seeking behavior. We have to get to them. People like Dr. Khandari are getting out there. We have to strengthen their hands. And our people. In Kerala, would you believe it? There are more than 450 organizations. More than 300 of them are registered organizations. Taking responsibility for people in health-related suffering in their own communities. The strengthening should happen there. Whoever wants to go further, their hand needs to be strengthened. And the public health system needs to be strengthened. Again, when we talk about Kerala, people say it will work only in Kerala. That's not really true. I have seen it happen in Vardha, where the medical college team goes out to 80 villages and gives care there, engaging the local community. It's happening. If only we want to, it can happen. So that philosophy of people being reached where they are and CSR initiatives supporting these, that will be that combination. Advocacy, making this suffering visible. Secondly, making their hands, strengthening the hands of people who reach out into the community. Those are the key things.
Thank you so much, Dr. Rajgopal. So, with this, I would try to sum up this our discussion, and definitely as we began, and by saying that how we can plan to ensure that we stop healthy people getting sick, and for this, what we need to have is equitable access for preventive care, not only in our cities but also to our villages and to all those areas which has been neglected and has not been part of the mainstream health planning. Corporates and many organizations such as that of Mr. Khanderia or that of Dr. Rajgopal have the responsibility to ensure that the bridge is made to reach this healthcare or the preventive care education to these marginalized, unserved, underserved people uh, in time, so that we are able to save as many people as possible, at the same time are also able to make them more productive and contribute to the well-being of their family as well as the society. So with this, thank you so much for your participation, your sharing your thoughts and your vision with us. And with this, we conclude our first day of CSR Health Impact Summit and Awards. We will be coming back tomorrow morning at 11 o'clock with our second day of summit with a host of other key experts and evangelists of social responsibility and health champions, which will also be concluded with tomorrow evening with a award recognizing some good work and some wonderful initiatives of various organizations during this COVID-19 period, as well as for health related areas beyond pandemic as well. So thank you so much. With this, goodbye to our viewers, and we will come back tomorrow at 11 o'clock.
Thank you, Kamal.
Health is one of the most critical indicators of country's development. A nation whose citizens do not have access to quality healthcare cannot hope to become a global power. With rising incidence of lifestyle diseases and continuing prevalence of malnutrition and communicable diseases, India has been facing a complex healthcare scenario. Given the range of health challenges, it was deemed imperative to create neutral spaces to get everyone talking about health. Thus, the integrated health and well-being Impact Awards, a became yet another IHW Council platform to launch various impactful programs that aimed to drive the country towards better health. Continuing with our efforts, we bring to you the prestigious 4th CSR Health Impact Awards 2020 COVID edition. While the world entered into the year of health hazards, economy and social uncertainties due to COVID-19 pandemic, we become more firm and responsible in our ideology to promote health for all, engage more entities working towards uplifting the communities, societies and needy, and trying to support the government initiatives for the health and environment for the people of our country. Therefore, we felt the need for continuing our 4th edition of CSR Health Impact Awards 2020 with the focus on highlighting the contribution of organizations and individuals fighting COVID-19 and also the noticeable achievements in the main CSR categories. We thank our distinguished jury members for their kind help and contribution as the jury of the 4th edition, and also prominent organizations as our supporters and partners. We are truly honored and thank them for their most valuable support for their health initiative and to the Council.